Welcome back. If you're watching this, you've already completed part 1 of the Advanced Cat Care Masterclass. You've spent hours learning about cat psychology, kitten development, training techniques, genetics, nutrition, dental care, litter box solutions, anxiety management, multi-cat households, body language, enrichment, diagnostics, heart disease, and kidney disease. That's not casual cat ownership. That's commitment. That's expertise in the making. And I want to acknowledge that because not everyone makes it this far. Most people stop at the basics. They learn how to feed their cat, scoop the litter box, and that's about it. But you're here, ready for part 2, which means you want more. You want to truly master cat care at a level that goes beyond what most veterinarians even discuss with their clients. So let's talk about what we're covering in this part, because it's heavy. We're going into chronic disease management that many of you will face as your cats age. Diabetes, where you'll learn to give insulin injections, monitor blood sugar, and potentially even achieve remission. Hyperthyroidism, one of the most common hormonal disorders in senior cats, and the various treatment options from medication to radioactive iodine therapy. And cancer, which is a word nobody wants to hear, but that affects too many cats. And you need to know your options, what treatments exist, and how to make informed decisions. We're covering disabled cat care, because cats who lose mobility, vision, or hearing can still have excellent quality of life if you know how to support them. We're diving into feral and semi-feral cat socialization for those of you who rescue or encounter cats who've never learned to trust humans. This is challenging, often frustrating work, but when it succeeds, it's incredibly rewarding. We're going to master practical skills that intimidate most cat owners, giving medications, pills, liquids, even injections at home. Because if you have a cat with chronic illness, you need to be comfortable with this. We're walking through complete post-surgery care, so you know exactly how to help your cat recover after procedures. We're covering international moving for those of you facing relocations across borders with complex regulations and quarantine requirements. And then, we're going to talk about the topic most people avoid until it's too late: end-of-life care. Not just the mechanics of euthanasia, though we'll cover that, but the weeks and months leading up to it. How to assess quality of life honestly, how to provide hospice care at home, how to know when it's time, and how to cope with the grief afterward. This is knowledge nobody wants to need, but everyone with a cat eventually will need. And having it before you're in crisis makes an enormous difference. We're also covering cat-proofing for specific dangers that most people never think about until tragedy strikes. Advanced grooming techniques for long-haired cats, difficult cats, or cats with special grooming needs. And for those interested, we'll explore the world of cat shows and competitions, what that world looks like, and whether it might be something you'd enjoy. Finally, we're wrapping up by looking forward, the future of cat care. New research that's changing what we know about feline health and behavior, technology from health monitoring apps to automatic litter boxes that track urination patterns, advances in veterinary medicine that are extending cats' lives and improving their quality of life, where the field is headed in the next 5, 10, 20 years. This part is different from part 1. Part 1 was foundational advanced knowledge, things every serious cat owner should know. Part 2 is specialized. Some of this you might never need. Maybe your cat will never develop diabetes or cancer. Maybe you'll never need to socialize a feral cat or move internationally. But when you do need this information, you'll need it desperately. And having it ahead of time, before you're in crisis mode, means you can make better decisions, act more confidently, and ultimately provide better care. Here's what I want you to understand about this level of cat care knowledge. It changes how you see your cat and your relationship with them. When you understand disease processes, you catch problems earlier. When you know how to assess quality of life, you make better end-of-life decisions. When you're comfortable giving medications and providing medical care at home, you reduce stress for your cat and save money on vet visits. When you understand behavior modification at an advanced level, you can solve problems that would cause other people to surrender their cats. This isn't just information, it's empowerment. It's the difference between being at the mercy of circumstances and being able to advocate effectively for your cat, make informed decisions, and provide care that most cat owners can't. Some of what we're covering is going to be emotional. Talking about cancer, about end of life, about cats in crisis, it's hard. If you need to take breaks, take them. If certain sections are too painful right now because you're dealing with these issues in real time, skip them and come back when you're ready. There's no judgment here. This is heavy material, and it affects us emotionally because we love our cats. But I promise you, the knowledge is worth it. Every single topic we're covering exists because these situations happen. Cats get sick, they age, they face medical crises, they need specialized care, and the more you know, the better equipped you are to help them through it. So take a deep breath, maybe grab some water or tea, get comfortable. And let's dive into part 2 of the Advanced Cat Care Masterclass. We're going to cover chronic diseases, specialized care, practical medical skills, difficult decisions, and the future of feline medicine. It's comprehensive, it's detailed, and by the end, you'll have knowledge that puts you in the top tier of cat owners worldwide. Your cat is lucky to have you. Let's get started. Section 1. Diabetes in cats. Full protocol. Diabetes mellitus is one of the most common endocrine disorders in cats, affecting an estimated 1 in 200 to 1 in 400 cats, with rates increasing due to rising obesity. And here's what most people don't know. Feline diabetes is often manageable, sometimes even reversible. Unlike in humans or dogs, where diabetes is typically a lifelong condition, many cats can achieve remission with proper treatment. Their blood sugar returns to normal, and they no longer need insulin. But getting there requires knowledge, commitment, and consistent care. We're going to cover everything: how diabetes develops in cats, how it's diagnosed, insulin therapy, and how to give injections at home, blood glucose monitoring, and how to do it yourself, achieving and maintaining remission, diet for diabetic cats, managing complications, and what to do in emergencies like hypoglycemia. Let's start with understanding what diabetes actually is. Diabetes is a disorder of glucose metabolism. Glucose is the body's primary fuel source. After eating, carbohydrates are broken down into glucose, which enters the bloodstream. The pancreas produces insulin, a hormone that acts like a key, unlocking cells so glucose can enter and be used for energy. In diabetes, one of two things happens. Either the pancreas doesn't produce enough insulin, called type 1 diabetes, or the cells become resistant to insulin's effects, called type 2 diabetes. Most cats have type 2 diabetes, though the distinction isn't always clear-cut. Without adequate insulin function, glucose can't enter cells. It accumulates in the bloodstream, causing hyperglycemia or high blood sugar. Meanwhile, cells are starving for fuel, even though the blood is full of glucose they can't access. The body tries to compensate by breaking down fat and muscle for energy, causing weight loss despite adequate or even increased food intake. The kidneys try to eliminate excess glucose by dumping it into urine, but glucose pulls water with it through osmosis, causing excessive urination. The cat becomes dehydrated and drinks excessively to compensate. This is why the classic signs of diabetes are increased thirst and urination, increased appetite, and weight loss. Risk factors for feline diabetes include obesity, which is the biggest modifiable risk factor. Fat tissue produces hormones that interfere with insulin function. Neutered male cats are at higher risk than females. Age is a factor. Most diabetic cats are over 7 years old. Certain medications, particularly corticosteroids, can trigger diabetes. Chronic pancreatitis damages the pancreas and can lead to diabetes. And some cats are genetically predisposed, particularly Burmese cats. Diagnosis is straightforward in most cases. Blood glucose is measured. Normal fasting glucose in cats is typically between 70 and 120 milligrams per deciliter. Diabetic cats usually have glucose well over 200, often 300 to 500 or higher. But here's a complication: stress, hyperglycemia. Many cats spike their blood sugar at the vet due to fear and stress. A single high glucose reading doesn't definitively diagnose diabetes. This is where fructosamine comes in. Fructosamine reflects average blood glucose over the past 2 to 3 weeks. It's not affected by short-term stress. Elevated fructosamine confirms sustained high blood sugar, not just a stress spike. Urinalysis shows glucose in the urine, called glucosuria. When blood glucose exceeds about 200 to 250, it spills into urine. Some diabetic cats also have ketones in their urine, which indicates diabetic ketoacidosis, a life-threatening complication we'll discuss later. Once diabetes is diagnosed, treatment begins immediately. The goals are to eliminate symptoms, prevent complications, and ideally achieve remission. Treatment has 3 pillars: insulin therapy, diet, and monitoring. Let's talk about insulin first. Several types of insulin are used in cats. Glargine, sold as Lantus, is a long-acting insulin that's very effective in cats and commonly prescribed. It's given twice daily, typically every 12 hours. Detamir, sold as Levemir, is another long-acting option. PZI, or protamine zinc insulin, is specifically formulated for cats and dogs and is also commonly used. Your vet will prescribe a specific insulin type and starting dose. Insulin comes in vials or pens. You'll need insulin syringes, which are small with very fine needles. The syringes are calibrated in units, and you'll give the exact dose prescribed. Here's how to give insulin injections. Store insulin in the refrigerator, but roll the vial gently between your hands to warm it slightly and mix it before drawing up the dose. Don't shake it vigorously. Draw the prescribed dose into the syringe. Pick up a fold of loose skin on your cat's back, between the shoulder blades or along the side. Insert the needle under the skin, not into muscle. Push the plunger to inject the insulin. Remove the needle and dispose of it in a sharps container. Rotate injection sites to prevent tissue damage. Don't inject in the same spot every time. Most cats tolerate injections well once they're used to the routine. Give the injection at the same times every day, typically around meal times. Blood glucose monitoring is critical. Your vet will recheck blood glucose periodically to ensure the insulin dose is appropriate. But home monitoring is even better. You can purchase a pet glucose meter or use a human glucose meter, which works fine for cats. Here's how to do it at home. You'll need a glucose meter, test strips, and a lancing device to prick your cat's skin and get a drop of blood. The ear is the easiest site. The marginal ear vein runs along the outer edge of the ear. Use the lancing device to prick the vein. A tiny drop of blood appears. Touch the test strip to the drop. The meter reads the glucose level within seconds. Home monitoring allows you to create glucose curves, where you measure blood glucose every 2 hours throughout the day to see how the insulin is working. This helps your vet adjust the dose precisely. It also lets you catch hypoglycemia, or low blood sugar, which is the most dangerous complication of insulin therapy. Hypoglycemia occurs when insulin dose is too high, or when a cat doesn't eat before receiving insulin. Blood glucose drops below 70, sometimes much lower. Signs include weakness, wobbly walking, disorientation, seizures, or collapse. Severe hypoglycemia is an emergency. If your cat shows signs, rub corn syrup or honey on their gums immediately. The sugar absorbs through the mucous membranes even if the cat can't swallow. Then get to the vet. This is why you never give insulin to a cat who hasn't eaten. If your cat refuses breakfast, skip that insulin dose. Don't try to make up for it later. Missing one dose is much safer than causing hypoglycemia. Diet is the second pillar of diabetes management. Diabetic cats need a diet low in carbohydrates and high in protein. Carbohydrates break down into glucose, spiking blood sugar. Protein provides steady energy without glucose spikes. Most dry cat foods are high in carbohydrates, often 30 to 40% or more. Wet foods are generally lower in carbohydrates and higher in protein and moisture. For diabetic cats, feeding primarily or exclusively wet food is ideal. Prescription diabetic diets like Hill's M/D or Royal Canin, Glycobalance are formulated specifically for diabetic cats. They're very low carbohydrate, high protein, and many cats do well on them. But some cats won't eat prescription diets. Any high-quality, low-carbohydrate wet food is better than dry food or a prescription diet the cat refuses to eat. Feed at consistent times, ideally right before insulin injections. This ensures the cat has food in their system when insulin peaks. Some cats do well with free feeding throughout the day, others need scheduled meals. Work with your vet to find what works for your cat. Weight loss, if your cat is overweight, is crucial. Obesity drives insulin resistance. As cats lose weight, insulin sensitivity improves. Many cats who achieve remission do so after weight loss. But weight loss must be gradual. Rapid weight loss in cats can cause hepatic lipidosis, a dangerous liver condition. Aim for about 1 to 2% of body weight per week. Now let's talk about remission, because this is the goal for many diabetic cats. Remission means blood glucose returns to normal without insulin. The cat no longer shows diabetic symptoms. They may stay in remission for months, years, or even the rest of their life. Remission is most likely in cats who are diagnosed early, treated aggressively from the start, lose weight if obese, and eat a low-carbohydrate diet. Cats on glargine insulin seem to achieve remission more frequently than those on other insulin types, though this varies. How do you know if your cat is in remission? Blood glucose consistently stays in the normal range even as you reduce insulin dose. Eventually, you stop giving insulin entirely, and glucose remains normal. Fructosamine drops into the normal range. The cat shows no diabetic symptoms. But remission isn't always permanent. Some cats relapse months or years later and need insulin again. Continued weight management, low-carbohydrate diet, and regular monitoring help maintain remission. Complications of diabetes include diabetic ketoacidosis, or DKA, which is a life-threatening emergency. It occurs when the body breaks down fat so rapidly that ketones, toxic byproducts, accumulate in the blood. Signs include vomiting, lethargy, rapid breathing, acetone smell on the breath, and collapse. DKA requires immediate hospitalization with intravenous fluids and insulin. It's often triggered by infection, pancreatitis, or poorly controlled diabetes. Diabetic neuropathy is another complication. High blood glucose damages nerves, particularly in the hind legs. Affected cats walk with their hocks touching the ground instead of walking on their toes, called a plantigrade stance. The good news is that diabetic neuropathy often reverses with good glucose control. As blood sugar normalizes, nerve function improves, and the abnormal gait resolves. Cataracts can develop in diabetic cats, though this is less common than in diabetic dogs. Persistently high glucose damages the lens of the eye, causing cloudiness and vision impairment. Urinary tract infections are more common in diabetic cats. Glucose in the urine provides a food source for bacteria. Watch for signs like straining to urinate, blood in urine, or frequent small urinations. Regular urinalysis can catch infections early. Here's a realistic timeline for managing a newly diabetic cat. Week 1. Diagnosis, starting insulin, learning to give injections, dietary changes. This is overwhelming, and that's normal. Week 2 to 4. Adjusting to the routine, possibly adjusting insulin dose based on glucose monitoring. Month 2 to 3, glucose stabilizing, symptoms improving, possibly working toward remission. Month 3 to 6, continued monitoring, insulin dose adjustments, possibly achieving remission. Some cats stabilize quickly, others take months to regulate. Some never achieve perfect control but do well enough that symptoms are managed and quality of life is good. Living with a diabetic cat requires commitment. Twice daily insulin injections at consistent times, regular glucose monitoring, whether at the vet or at home, feeding a specific diet at specific times, watching for signs of hypoglycemia or other complications, vet visits for rechecks and blood work. But here's what I want you to know. Thousands of cat owners successfully manage diabetes at home. It becomes routine. The TET injections take 30 seconds. The glucose checks take 2 minutes. And the reward is a cat who feels good, maintains healthy weight, and may even achieve remission. Diabetes is serious, but it's not a death sentence. With proper treatment, diabetic cats can live for years with excellent quality of life. Some achieve remission and never need insulin again. Others stay on insulin long-term but do beautifully. If your cat is diagnosed with diabetes, don't panic. Work closely with your vet. Learn the skills you need. Commit to the routine. Monitor carefully, and know that you can do this. Thousands of cat owners have navigated this successfully, and you can too. Your cat is depending on you, and with the knowledge you now have, you're ready to help them. Section 2. Feline hyperthyroidism management. Let's talk about hyperthyroidism, which is the most common hormonal disorder in older cats. If you have a cat over the age of 10, there's a significant chance they'll develop this condition at some point. And the frustrating thing is that for decades, we didn't know what caused it. Even now, the exact cause remains somewhat unclear, though we have theories. What we do know is that hyperthyroidism is highly treatable. Cats diagnosed with this condition can live for years with good quality of life if the disease is managed properly. We're going to cover what hyperthyroidism is, how it presents, how it's diagnosed, the 4 main treatment options and the pros and cons of each, managing complications, especially the impact on kidneys and heart, monitoring disease progression, and what to expect long-term. Hyperthyroidism means the thyroid gland is producing too much thyroid hormone. The thyroid is a small butterfly-shaped gland in the neck that regulates metabolism. Thyroid hormone controls how fast the body's cells work, affecting heart rate, digestive speed, body temperature, and energy use. In hyperthyroid cats, one or both lobes of the thyroid gland develop benign tumors called adenomas. These tumors produce thyroid hormone uncontrollably, flooding the body with excess hormone. The result is that everything speeds up. The heart races. Metabolism cranks into overdrive. The cat burns through calories at an unsustainable rate. The classic presentation is an older cat, usually over 10 years old, who's losing weight despite eating like they're starving. They're ravenously hungry, often demanding food constantly, yet getting thinner. Their coat might look unkempt or greasy. They're hyperactive, sometimes almost manic, unable to settle. They might vomit frequently. They drink and urinate excessively. Some become vocal, yowling at odd hours. But not all hyperthyroid cats fit this classic picture. Some, especially in early stages, show subtle signs: mild weight loss, slightly increased appetite, a bit more active than usual for a senior cat. Some cats show primarily gastrointestinal signs like vomiting and diarrhea without obvious hyperactivity. And here's a complication. Some hyperthyroid cats, particularly those who are very sick or have concurrent illnesses, develop apathetic hyperthyroidism. Instead of being hyperactive and ravenous, they're lethargic, depressed, and have poor appetite. This is the opposite of what you'd expect, and it can delay diagnosis because the cat doesn't fit the typical profile. Physical exam findings include weight loss and muscle wasting despite good or increased appetite. The heart rate is often elevated, sometimes well over 200 beats per minute. A heart murmur might be present due to the strain on the heart. The thyroid gland might be palpably enlarged, though not always. Some cats have hypertension or high blood pressure as a consequence of hyperthyroidism. Diagnosis starts with blood work. Total T4, which measures thyroid hormone levels, is the screening test. Normal T4 in cats is typically between 1 and 4 micrograms per deciliter, though reference ranges vary slightly between labs. Hyperthyroid cats usually have T4 well above the normal range, often 6, 8, 10, or higher. But here's where it gets tricky. Some cats with hyperthyroidism have T4 levels that fluctuate. One day it's elevated, confirming hyperthyroidism. A week later, it's high normal or even mid-normal range. This doesn't mean the cat isn't hyperthyroid. Thyroid hormone levels can fluctuate, and a single normal T4 doesn't rule out the disease if clinical signs strongly suggest it. Additionally, some cats with early hyperthyroidism have T4 at the high end of normal, but haven't tipped over into obviously abnormal territory yet. If the cat shows classic signs but T4 is borderline, your vet might recommend retesting in 4 to 6 weeks. Often, the T4 will have climbed higher by then. Free T4 is a more sensitive test that measures the active fraction of thyroid hormone. It can detect hyperthyroidism in cats whose total T4 is still normal or borderline. If your vet suspects hyperthyroidism but total T4 is inconclusive, free T4 can provide clarity. Thyroid scintigraphy, a nuclear medicine scan, is the gold standard for diagnosis and also identifies the location and size of thyroid tumors. Radioactive technetium is injected, and the thyroid tissue absorbs it. A special camera creates images showing how much and where the thyroid is overactive. This test is expensive and requires referral to a specialty center, so it's typically done when diagnosis is unclear or when planning radioactive iodine treatment. Once hyperthyroidism is confirmed, you need to choose a treatment approach. There are 4 main options: medication, radioactive iodine therapy, surgery, and prescription diet. Each has advantages and disadvantages. Medication is the most common initial choice. Methimazole is the drug used in cats. It blocks thyroid hormone production, bringing levels down into the normal range. It doesn't cure hyperthyroidism, it controls it. If you stop the medication, thyroid levels rise again. Methimazole comes as oral tablets or a transdermal gel applied to the inside of the ear. The gel is easier for cats who are difficult to pill, but it's more expensive, and some cats develop skin reactions at the application site. Tablets are cheaper and effective if your cat tolerates pilling. Starting dose is typically low, around 2.5 milligrams twice daily for tablets. Thyroid levels are rechecked after 2 to 3 weeks, and the dose is adjusted as needed. Some cats need higher doses, up to 5 milligrams twice daily or more. Once the dose is stable and thyroid levels are controlled, rechecks happen every 3 to 6 months. Side effects are usually mild but can include vomiting, loss of appetite, or lethargy, especially in the first few weeks. These often resolve as the cat adjusts. Rarely, more serious side effects occur: severe vomiting, facial itching, or blood abnormalities like low platelet counts or anemia. If serious side effects develop, the medication is stopped and an alternative treatment pursued. The advantage of medication is that it's reversible. If side effects occur, you stop the drug. It's the least invasive option. It allows you to see how your cat does with normal thyroid levels before committing to permanent treatments. This is important because sometimes normalizing thyroid hormone unmasks underlying kidney disease, which we'll discuss shortly. The disadvantages are that it's lifelong medication requiring twice daily dosing. It's an ongoing expense. Compliance is critical. Missing doses allows thyroid levels to rise again, and not all cats tolerate it due to side effects. Radioactive iodine therapy, or I-131 treatment, is considered the gold standard and the closest thing to a cure. Radioactive iodine is injected once. It's absorbed by the overactive thyroid tissue and destroys it through targeted radiation. Normal thyroid tissue and surrounding structures aren't affected because they don't absorb iodine the same way. The treatment is very effective. Over 95% of cats are cured with a single injection. Some cats with severe disease might need a second dose, but that's uncommon. There's no anesthesia required, no surgery, and once the treatment is done, no ongoing medication. The disadvantages are cost, which is typically $1,500 to $2,000 or more, and availability. Radioactive iodine treatment requires specialized facilities, so you'll need to travel to a referral center that offers it. After treatment, your cat is radioactive for a period and must stay hospitalized, isolated in a special facility, typically for 1 to 2 weeks depending on regulations. You can't visit during this time. Additionally, some cats become hypothyroid after treatment, meaning their thyroid hormone drops too low. This happens in about 2 to 5% of treated cats. If it occurs, they need thyroid hormone supplementation for life, but that's a simple once-daily pill. The other consideration is the kidney issue we mentioned. We'll dive deeper into this in a moment, but radioactive iodine is permanent. If it reveals kidney disease that was masked by hyperthyroidism, you can't reverse the treatment. Surgical thyroidectomy, removing the thyroid gland, was common before radioactive iodine became widely available. It's less common now, but still an option. One or both thyroid lobes are surgically removed under general anesthesia. Surgery can be curative if both lobes are removed. The advantage is that it's a one-time procedure. The disadvantages are that it requires anesthesia, which is risky in older cats, especially those with heart complications from hyperthyroidism. There are surgical risks including damage to the parathyroid glands, which sit next to the thyroid and regulate calcium levels. If parathyroids are damaged, the cat can develop life-threatening low calcium levels requiring intensive management. Hypothyroidism can also occur after surgery if too much thyroid tissue is removed. And if only one lobe is removed because the other appears normal, hyperthyroidism can recur if that lobe develops a tumor later. Surgery is most appropriate for cats with single-sided thyroid tumors, young enough to tolerate anesthesia well, or in situations where radioactive iodine isn't available and medication isn't feasible. The fourth option is prescription diet, specifically Hill's Y/D. This diet is extremely low in iodine. Since the thyroid needs iodine to produce thyroid hormone, restricting dietary iodine limits hormone production. The diet can control hyperthyroidism if it's the only thing the cat eats. No treats, no other food, nothing. This is the major limitation. Compliance is very difficult in multi-cat households unless all cats eat Y/D, and many cats simply won't eat it or get bored with it over time. The diet is reversible and non-invasive, which are advantages, but it can take weeks to months to work. Thyroid levels decrease slowly as dietary iodine is depleted, and the moment the cat eats something else, thyroid levels can spike again. Most vets don't recommend Y/D as a first-line treatment unless other options aren't feasible. It's more commonly used as a temporary measure while awaiting radioactive iodine treatment or in cats who can't tolerate medication. Now let's talk about the kidney complication, because this is critical to understand. Hyperthyroidism increases blood flow to the kidneys. This temporarily improves kidney function, masking underlying chronic kidney disease. When you treat the hyperthyroidism, blood flow to the kidneys decreases to normal levels. If the kidneys have chronic damage, this reduced blood flow unmasks the kidney disease. Kidney values that were normal on blood work suddenly become elevated. This happens in about 15 to 20% of hyperthyroid cats. It doesn't mean treating the hyperthyroidism caused kidney disease. The kidney disease was there all along, just hidden. This is why medication is often started first. You can adjust the dose to keep thyroid levels in the high normal range rather than low normal. This maintains some of that increased kidney blood flow while still controlling hyperthyroid symptoms. It's a compromise, but it allows cats with underlying kidney disease to maintain better kidney function. With radioactive iodine or surgery, you can't fine-tune the result. The treatment is permanent. If kidney disease is unmasked severely, you're managing both conditions, which is doable, but more complicated. Some vets recommend a medication trial for several weeks before pursuing radioactive iodine, specifically to see if kidney disease emerges. If kidney values worsen significantly on medication, you know to expect that with permanent treatment and can plan accordingly. Heart complications from hyperthyroidism are also common. The heart is forced to beat rapidly and work hard for months or years. This can cause the heart muscle to thicken, a condition called hypertrophic cardiomyopathy, secondary to hyperthyroidism. Heart murmurs develop. Some cats develop congestive heart failure. The good news is that many of these heart changes are reversible. Once thyroid levels normalize, heart rate slows, the heart muscle often returns to normal thickness, and murmurs sometimes disappear. But if hyperthyroidism has been present for a long time before treatment, permanent heart damage might have occurred. Hypertension, or high blood pressure, is another complication. High thyroid hormone increases blood pressure. Chronic high blood pressure can damage kidneys, eyes potentially causing retinal detachment and blindness, and the brain. Blood pressure should be monitored in all hyperthyroid cats and treated if elevated. Monitoring after treatment depends on the method chosen. Cats on methimazole need thyroid levels checked every few weeks initially, then every 3 to 6 months once stable. Blood work to monitor for side effects is checked periodically, especially in the first few months. Cats treated with radioactive iodine have thyroid levels checked at regular intervals for the first year to ensure they stay in the normal range and to detect hypothyroidism if it develops. Once stable, annual monitoring is usually sufficient. All hyperthyroid cats, regardless of treatment, need regular kidney function monitoring, blood pressure checks, and heart evaluations because these are the organs most affected by the disease. Prognosis for hyperthyroid cats is generally excellent with treatment. Median survival after diagnosis is about 2 to 3 years, but many cats live much longer. The limiting factor is usually not the hyperthyroidism itself, but concurrent diseases like kidney disease or cancer that are common in senior cats. Untreated hyperthyroidism, on the other hand, is eventually fatal. The cat continues losing weight, the heart becomes damaged, and complications like heart failure or severe hypertension develop. Quality of life deteriorates, and lifespan is significantly shortened. If your cat is diagnosed with hyperthyroidism, the decision about which treatment to pursue depends on several factors: your cat's age and overall health, whether they tolerate medication, whether radioactive iodine is available and affordable, whether kidney disease is a concern, your ability to commit to lifelong medication, and your cat's personality and stress tolerance. Discuss all options with your vet. For many cats, starting with medication is a reasonable approach. It controls the disease, gives you time to assess how your cat responds, and reveals whether kidney disease is lurking. If medication works well and your cat tolerates it, you can continue long-term. If it doesn't work well or you prefer a curative approach, you can pursue radioactive iodine later. Hyperthyroidism is one of the most treatable diseases in older cats. Diagnosis is straightforward, treatment options are effective, and most cats do beautifully once their thyroid levels are controlled. The key is recognizing the signs early, getting prompt diagnosis, choosing the treatment approach that fits your situation, and following through with monitoring. Your senior cat losing weight and acting crazy isn't just getting old. It might be hyperthyroidism, and that's fixable. Don't accept decline as inevitable. Get blood work done. If hyperthyroidism is diagnosed, treat it. You'll likely get years of quality time back with your cat, and they'll feel so much better once those thyroid levels come down. Section 3. Cat cancer. Types, treatment, care. Let's talk about cancer. This is the section nobody wants to need, but many of you will. Cancer is one of the leading causes of death in cats, particularly senior cats. And it's a word that carries enormous emotional weight. When your vet says, "I'm concerned this might be cancer," everything else stops. Your mind races. You think about worst-case scenarios. You might immediately jump to thoughts about losing your cat. So before we dive into specifics, I want to say this. Cancer in cats is not automatically a death sentence. Some cancers are highly treatable, even curable. Others are manageable for extended periods, giving your cat months or years of good quality life. And even when cancer isn't curable, there are ways to keep your cat comfortable, manage symptoms, and ensure their remaining time is good. We're going to cover the most common types of cancer in cats, how they present and are diagnosed, treatment options including surgery, chemotherapy, and radiation, what chemotherapy actually looks like in cats, because it's different from humans. Quality of life considerations, making treatment decisions based on your cat's individual situation, and palliative and hospice care for cats whose cancer can't be cured. This is heavy material. It's okay to feel emotional reading it. Take breaks if you need them, but stay with me, because this information empowers you to make informed decisions if your cat ever faces this diagnosis. Let's start with understanding what cancer actually is. Cancer occurs when cells divide and grow uncontrollably. Normally, cells grow, divide in a regulated way, and die when they're old or damaged. Cancer cells ignore these controls. They keep dividing, forming masses or tumors, and sometimes spread to other parts of the body through the bloodstream or lymphatic system, a process called metastasis. Not all tumors are cancer. Benign tumors grow but don't invade surrounding tissue or metastasize. They can still cause problems through size or location, but they're not cancer. Malignant tumors are cancer. They invade nearby tissue and can spread to distant organs. The most common cancer in cats is lymphoma, accounting for about 30% of all feline cancers. Lymphoma is cancer of lymphocytes, a type of white blood cell. It can occur almost anywhere in the body because lymphoid tissue is widespread. There are several forms of feline lymphoma. Alimentary lymphoma affects the gastrointestinal tract, particularly the intestines. This is the most common form in cats. Signs include weight loss, vomiting, diarrhea, decreased appetite, and sometimes a palpable mass in the abdomen. It's more common in older cats and may be associated with inflammatory bowel disease. Mediastinal lymphoma affects the thymus gland in the chest. It causes difficulty breathing, coughing, and sometimes fluid accumulation around the lungs. This form is more common in young cats and is often associated with feline leukemia virus infection. Renal lymphoma affects the kidneys. Signs include kidney failure symptoms, increased thirst and urination, weight loss, vomiting, and poor appetite. Both kidneys are usually affected and they become enlarged. Nasal lymphoma affects the nasal passages. Cats present with chronic nasal discharge, often bloody, sneezing, facial swelling, and difficulty breathing through the nose. There are other less common locations, including skin, eyes, nervous system, and multicentric lymphoma, where multiple lymph nodes throughout the body are affected. Diagnosis of lymphoma typically requires a biopsy, where a sample of the affected tissue is examined under a microscope. For intestinal lymphoma, this might require surgery or endoscopy. For nasal lymphoma, a nasal biopsy under sedation. For enlarged lymph nodes, a fine needle aspirate where cells are extracted with a needle might provide enough information. Treatment for lymphoma is primarily chemotherapy. Lymphoma cells are very responsive to chemotherapy, and many cats achieve remission, where the cancer becomes undetectable. Remission isn't cure. The cancer usually comes back eventually, but remission can last months to over a year, and some cats go through multiple rounds of remission. Chemotherapy protocols vary. The most common is called CHOP, using multiple drugs in combination: cyclophosphamide, doxorubicin, vincristine, and prednisone. Treatment typically involves weekly injections or pills for several weeks, then less frequent maintenance doses. Squamous cell carcinoma is another common cancer in cats. It's a skin cancer that most often affects areas with little hair and pigmentation: the ear tips, eyelids, nose, and lips. Sun exposure is a major risk factor, so white cats or cats with white ears are at highest risk. Early squamous cell carcinoma appears as crusty, non-healing sores on the ear tips or nose. They might look like minor irritation at first, but they don't heal. They slowly grow, and eventually they become ulcerated, bleeding, painful lesions. Treatment for early squamous cell carcinoma is surgical removal with wide margins, meaning removing the tumor plus a significant amount of healthy tissue around it. For ear lesions, this might mean amputating part or all of the affected ear. For nasal or oral lesions, surgery can be more challenging depending on location and extent. Radiation therapy is also effective for squamous cell carcinoma, especially for tumors that can't be completely removed surgically. Prevention includes keeping white cats indoors or out of direct sun, applying pet-safe sunscreen to vulnerable areas, and monitoring for any suspicious lesions. Oral squamous cell carcinoma is a particularly aggressive form that affects the mouth, usually the gums, tongue, or under the tongue. It's often not detected until it's advanced, because it's hidden in the mouth. Signs include drooling, difficulty eating, dropping food, bad breath, and sometimes visible masses or bleeding in the mouth. Oral squamous cell carcinoma has a poor prognosis because it's usually diagnosed late. It invades bone rapidly, and it doesn't respond well to chemotherapy. Surgery can be attempted if the tumor is accessible and margins can be achieved, but this often requires removing part of the jaw. Radiation can slow growth and provide palliation. Many cats with oral squamous cell carcinoma are managed with pain control and supportive care rather than aggressive treatment. Mammary tumors, or breast cancer, are common in unspayed female cats. About 85 to 90% of feline mammary tumors are malignant. They appear as lumps or masses in the mammary tissue along the abdomen. They can be single or multiple, small or large. Spaying before the first heat cycle dramatically reduces mammary cancer risk. Spaying after 1 or 2 heat cycles still provides some protection, but less so. Spaying after the cat is older provides no protection against mammary cancer, though it still has other health benefits. Treatment is surgical removal, ideally removing the entire affected mammary chain, not just the individual tumor because microscopic cancer cells often spread through the tissue. Chemotherapy may be recommended after surgery to target any remaining cancer cells. Prognosis depends on tumor size. Tumors smaller than 2 centimeters have a better prognosis than larger ones. If the tumor has already metastasized to lymph nodes or lungs at diagnosis, prognosis is poor. Fibrosarcoma is a soft tissue cancer that can occur anywhere, but is most notorious for injection site-associated sarcomas. These tumors develop at sites where cats received injections, particularly vaccines, though the exact mechanism isn't fully understood. They're aggressive, invasive, and difficult to remove completely. Treatment requires very aggressive surgery with wide margins, removing not just the tumor, but several centimeters of healthy tissue in all directions. Even with aggressive surgery, recurrence is common. Radiation before or after surgery improves outcomes. Chemotherapy has limited effectiveness for fibrosarcoma. Because of injection site sarcomas, vaccination practices have changed. Vaccines are now given in specific locations, typically in the limbs rather than between the shoulders, so that if a tumor develops, the limb can potentially be amputated to remove it entirely. This sounds drastic, but 3-legged cats do remarkably well. Mast cell tumors are another common skin cancer in cats. They range from benign, slow-growing lumps to aggressive metastatic cancers. Most feline mast cell tumors are on the skin and are relatively benign, but intestinal and visceral mast cell tumors are more aggressive. Diagnosis requires biopsy or fine needle aspirate. Treatment is surgical removal with clean margins. Prognosis for skin mast cell tumors is generally good if completely removed. Visceral mast cell tumors have a poorer prognosis. Now let's talk about diagnosing cancer in general, because the process is similar across cancer types. Diagnosis starts with identifying a problem: a lump, unexplained weight loss, persistent vomiting, difficulty breathing, whatever prompts the investigation. Imaging comes next. X-rays can show masses, enlarged organs, or metastasis to the lungs. Ultrasound evaluates abdominal organs and can distinguish solid masses from fluid-filled structures. CT scans and MRI provide detailed images but require general anesthesia and are expensive. Biopsy is the definitive diagnostic tool. A sample of the suspicious tissue is examined microscopically by a veterinary pathologist. They identify the cell type, determine if it's cancer, and often provide a grade indicating how aggressive the cancer is. Fine needle aspirate is less invasive than surgical biopsy. A needle extracts cells from a mass. It's quick, often done without sedation, and can provide a diagnosis for some cancers, particularly lymphoma. But it doesn't always provide enough information, and surgical biopsy may still be needed. Blood work doesn't diagnose most cancers directly, but can identify secondary effects. Anemia, abnormal white blood cell counts, or elevated calcium can be clues. For some cancers like lymphoma, abnormal cells might be visible in the blood. Staging determines how far the cancer has spread. This guides treatment decisions and prognosis. Staging typically involves imaging the primary tumor, checking lymph nodes, and looking for metastasis to common sites like lungs, liver, or other organs. Now let's talk about treatment options, starting with surgery. Surgery is the primary treatment for many solid tumors. The goal is complete removal with clean margins, meaning all cancer cells are removed and the edges of the excised tissue are free of cancer. Surgery can be curative for localized cancers caught early, but it's not always possible. Some tumors are in locations that make surgery dangerous or impossible. Some have already metastasized, and removing the primary tumor doesn't address spread. Chemotherapy in cats is very different from chemotherapy in humans. And this is important to understand because many people's fear of chemotherapy is based on what they've seen in human cancer treatment. Human chemotherapy often uses maximum tolerated doses to kill as much cancer as possible. Accepting severe side effects is necessary. Veterinary chemotherapy uses lower doses aimed at maintaining quality of life while still controlling cancer. The goal is remission or slowing cancer progression without making the cat miserable. Most cats tolerate chemotherapy remarkably well. They don't lose their fur, except in rare cases. They don't become violently ill. Many continue eating, playing, and behaving normally throughout treatment. Side effects can occur. The most common are mild gastrointestinal upset, decreased appetite, or lethargy for a day or two after treatment. These usually resolve quickly. Rarely more serious side effects like bone marrow suppression occur, but careful monitoring catches these early. Chemotherapy is given as injections at the vet clinic or as oral medications at home, depending on the drug and protocol. Treatment schedules vary from weekly to every few weeks to monthly maintenance after initial intensive treatment. Cost is a factor. Chemotherapy isn't cheap, often running into thousands of dollars for a full protocol. But for some cancers, particularly lymphoma, it offers meaningful remission time. Radiation therapy uses targeted radiation to kill cancer cells. It's effective for localized tumors, especially those that can't be completely removed surgically or for cancers highly sensitive to radiation, like nasal lymphoma or certain sarcomas. Radiation requires general anesthesia for each session to keep the cat perfectly still. Protocols typically involve multiple treatments over several weeks. Side effects depend on the area treated and can include skin irritation, inflammation of irradiated tissue, or hair loss in the treatment field. Radiation is only available at specialty centers with the necessary equipment, and it's expensive, often several $1,000s. But for the right tumor in the right location, it can achieve excellent results. Palliative care focuses on managing symptoms and maintaining quality of life when cancer isn't curable or when aggressive treatment isn't appropriate. Pain management, appetite stimulants, anti-nausea medications, fluid therapy, and supportive care keep the cat comfortable. Steroids like prednisone have anti-cancer effects on some tumors, particularly lymphoma, and they improve appetite and reduce inflammation. They're not curative, but can provide weeks to months of improved quality of life. Making treatment decisions is deeply personal and depends on many factors: your cat's age and overall health, the type and stage of cancer, available treatment options and their likelihood of success, cost, both financial and emotional, your cat's temperament and how they'll tolerate treatment, and your own values and goals. Some people choose aggressive treatment, pursuing every available option. Others choose palliative care, focusing on comfort rather than cure. Neither choice is wrong. What matters is making the decision that's right for your cat and your situation. Questions to ask when facing a cancer diagnosis: what type of cancer is it? What stage is it? What are the treatment options? What are the realistic outcomes with each option? What's the prognosis with treatment versus without? What will treatment involve for my cat? What's the expected quality of life during and after treatment? What will it cost? What happens if we don't treat? Your vet or a veterinary oncologist can help you understand the specifics of your cat's case. Don't make decisions based on emotion alone in the immediate shock of diagnosis. Take time to process, ask questions, and think about what's best for your cat. Quality of life is the guiding principle. If treatment will give your cat months or years of good quality time, it might be worth pursuing. If treatment will cause suffering for minimal benefit, palliative care might be kinder. Only you can decide where that line is for your cat. Some cats surprise everyone, responding better than expected, living longer than predicted. Others decline faster than anticipated. Cancer is unpredictable. All you can do is make the best decision with the information available and be willing to adjust course as circumstances change. If your cat is diagnosed with cancer, you're not alone. Thousands of cat owners have navigated this. Support groups, online forums, and veterinary oncology teams are resources. And remember, cancer is a diagnosis, not a death sentence. Many cats live well with cancer, whether in remission or managed with palliative care. Focus on quality, not just quantity. Make the time you have count. And when the time comes, whether that's months or years from diagnosis, be brave enough to let go with love rather than holding on past the point where life is good. Cancer is heartbreaking, but knowledge, compassionate care, and informed decision-making can make a difficult journey more bearable. Your cat needs you to be strong, informed, and focused on their well-being, and you can do that. Section 4. Disabled cat care. Let's talk about something that catches many cat owners off guard: disability. Your cat loses a leg to injury or cancer. They go blind from high blood pressure or progressive retinal atrophy. They become deaf from age or chronic ear infections. They lose mobility from spinal injury, arthritis, or neurological disease. And suddenly you're facing questions you never expected. Can my cat still have a good life? How do I care for them? What adaptations do they need? Should I even try, or is it kinder to euthanize? Here's what I want you to know right from the start. Disabled cats can have excellent quality of life. Cats are remarkably adaptable. They adjust to disabilities in ways that often astonish their owners. A 3-legged cat can run, jump, and play. A blind cat can navigate their home confidently. A deaf cat can live happily without ever knowing they're missing anything. A paralyzed cat can scoot around in a wheelchair and enjoy life. Disability doesn't automatically mean suffering. It means adaptation, both for the cat and for you. We're going to cover mobility aids and how to help cats who've lost limbs or mobility, caring for blind cats, and how they navigate the world without sight, deaf cat care and communication strategies, paralyzed cat care including bladder and bowel management, cats with chronic pain and how to keep them comfortable, and general principles for adapting your home and routine to support a disabled cat. Let's start with 3-legged cats, or tripods, because this is one of the most common disabilities and one of the easiest for cats to adapt to. Cats lose legs for various reasons: amputation after severe injury, bone cancer requiring limb removal, birth defects, or severe infections. Front leg amputation is generally easier for cats to manage than hind leg amputation because more of their weight is supported by the front legs. But cats adapt to both. The surgery removes the entire leg, including the shoulder blade for front legs or the hip for hind legs. This creates better weight distribution than leaving part of the limb. Recovery from amputation surgery takes a few weeks. Initially, the cat is unsteady, learning to balance on 3 legs. They might be reluctant to move much. Pain management is critical during this phase, but within days, most cats start figuring out their new gait. Within weeks, they're moving confidently. Within months, they're doing almost everything they did before. 3-legged cats can run, jump, climb, and play. They might approach things slightly differently. A cat missing a hind leg might jump with more deliberate planning. A cat missing a front leg might land differently, but they figure it out. Weight management is important for 3-legged cats because extra weight puts more strain on remaining legs. Keep your tripod at a healthy weight to reduce stress on joints. Provide low-entry litter boxes if jumping in and out of a standard box is challenging. Add steps or ramps to help access high places if jumping is difficult, though many tripods don't need this. Arthritis in the remaining legs is a concern as the cat ages because those limbs are working harder. Monitor for signs of pain or stiffness. Joint supplements, pain medication, or physical therapy might be needed later in life. Now let's talk about cats with mobility impairment who still have all 4 legs but can't use them properly. This might be from spinal injury, degenerative myelopathy, neurological disease, or severe arthritis. Some cats retain partial mobility. They can walk but are wobbly or weak. Others are completely unable to use their hind legs but have normal front leg function. A few are completely paralyzed. For cats with hind leg weakness or paralysis, wheelchairs designed for cats can restore mobility. These are carts with wheels that support the hind end, while the cat uses their front legs to propel themselves. Many cats adapt to wheelchairs quickly and love the independence they provide. You can purchase commercial cat wheelchairs or have one custom built for your cat's measurements. The cat wears a harness that attaches to the cart. Their hind legs hang or are supported by slings. They use their front legs to walk, run, and even play. Not every paralyzed cat needs or wants a wheelchair. Some are content to scoot around on their front legs, dragging their hind end. If they seem happy and aren't developing sores from dragging, this can work. Provide rugs or carpeted areas so they're not scooting on hard floors. Bladder and bowel management is the biggest challenge with paralyzed cats. Many paralyzed cats lose voluntary bladder and bowel control. They can't urinate or defecate on their own, or they leak constantly. Bladder expression is a technique where you manually empty the bladder by applying gentle pressure to the abdomen. Your vet can teach you how to do this. It typically needs to be done 2 to 3 times daily. If urine isn't emptied regularly, it backs up into the kidneys, causing infection and kidney damage. Not all bladders can be expressed. If the bladder is spastic or the cat has nerve damage preventing relaxation, expression doesn't work. Some cats need permanent urinary catheters or even surgical procedures to create alternative urine drainage. Bowel function in paralyzed cats varies. Some cats still defecate normally. Others need manual stimulation or gentle assistance. Some require stool softeners to keep things moving. Regular monitoring prevents constipation, which can become severe in immobile cats. Hygiene is critical. Paralyzed cats can't groom their hind end properly. They might sit in urine or feces. Daily cleaning with pet-safe wipes prevents urine scald, infections, and odor. Check for pressure sores from lying in one position too long. Blind cats are surprisingly adaptable. Cats rely heavily on senses other than vision. Their hearing is acute. Their sense of smell is powerful, and they have whiskers that detect objects and air currents, helping them navigate. Cats who lose vision gradually adapt more easily than those who go blind suddenly. Gradual vision loss from conditions like progressive retinal atrophy gives the cat time to adjust as their sight fades. Sudden blindness from acute glaucoma, retinal detachment, or trauma is more disorienting initially. The key to helping blind cats is keeping their environment consistent. Don't rearrange furniture. Blind cats create mental maps of their space, memorizing where everything is. Moving furniture disorients them. Keep food, water, and litter boxes in the same locations. Add textural cues. Different flooring textures help blind cats orient themselves. Carpet in the living room, tile in the kitchen, rugs near the litter box. They learn these textures and use them as landmarks. Use scent markers. A drop of vanilla extract on a corner near the litter box. A specific air freshener in one room. Scent helps blind cats know where they are. Talk to your blind cat. Use your voice to let them know where you are. Before petting them, say their name so you don't startle them. Your voice becomes a guide. Block off dangerous areas. Stairs, pools, or balconies need barriers. Blind cats can fall or get hurt in places they'd normally navigate visually. Many blind cats still play. Toys that make noise, crinkle, or have strong scents work well. Balls with bells inside, crinkly balls, or toys. Infused with catnip, provide sensory engagement. Blind cats can live full, happy lives. They adapt remarkably well. Some owners report their blind cats seem completely normal, navigating confidently, playing, and showing no signs of distress. Deaf cats face different challenges. Deafness in cats is often congenital, particularly in white cats with blue eyes. It can also result from chronic ear infections, certain medications, or age-related hearing loss. Deaf cats don't know they're missing anything if they've been deaf since birth. They live normal lives, just without sound. The main challenge is communication. You can't call a deaf cat. They won't come when you say their name. You need visual signals. Stomping on the floor creates vibrations they feel. Flicking lights on and off gets their attention. Hand signals can communicate commands if you train them. Deaf cats should be indoor only. They can't hear cars, predators, or other dangers. Outside is too risky. Some deaf cats are more vocal than hearing cats, often very loud because they can't hear themselves. This is harmless, just an adaptation. Deaf cats startle more easily because they can't hear you approaching. Always approach from the front where they can see you or gently touch them to wake them rather than surprising them. Cats with chronic pain from arthritis, cancer, or other conditions need pain management to maintain quality of life. Pain in cats is often subtle. They don't cry out or limp dramatically. Instead, they become less active, sleep more, groom less, or stop jumping to places they used to access. Pain medication options include NSAIDs, like meloxicam, though these must be used carefully in cats due to kidney sensitivity. Opioids like buprenorphine for moderate to severe pain, gabapentin, which helps with nerve pain and chronic pain, and tramadol, though its effectiveness in cats is debated. Non-pharmaceutical pain management includes joint supplements like glucosamine and chondroitin, omega-3 fatty acids for anti-inflammatory effects, physical therapy, including gentle range of motion exercises, acupuncture, which some cats tolerate well and which can provide pain relief. Environmental modifications reduce pain. Heated beds soothe achy joints. Low-entry litter boxes eliminate the need to jump. Ramps or steps to favorite perches. Soft bedding to cushion arthritic joints. General principles for caring for disabled cats apply across all disability types. Adapt the environment to your cat's needs. If they can't jump, bring resources to ground level. If they can't see, keep things consistent. If they can't hear, use visual signals. Maintain quality of life through pain management, enrichment appropriate to their abilities, and regular vet care to address complications. Monitor for secondary issues. Immobile cats are prone to urinary tract infections. Blind cats might develop anxiety. Deaf cats might become more territorial. Be patient during adjustment periods. It takes time for a cat to adapt to disability, whether it's sudden or gradual. There will be setbacks, frustrations, and learning curves for both of you. Focus on what your cat can do, not what they can't. A three-legged cat can still play. A blind cat can still hunt toys by sound. A deaf cat can still cuddle. A paralyzed cat can still enjoy sunny spots and good food. Disability changes how they experience life, but it doesn't eliminate their capacity for joy. Quality of life assessment is ongoing. Ask yourself, is my cat comfortable? Are they in pain? Do they still engage with life, show interest in food, seek interaction? Or are they withdrawn, suffering, unable to do things they enjoy? Disability alone doesn't mean poor quality of life, but disability combined with untreatable pain, inability to perform basic functions, or loss of interest in living might mean it's time for end-of-life conversations. Many disabled cats thrive. They adapt, they bond deeply with their caretakers, and they live happy lives. The internet is full of stories and videos of three-legged cats doing parkour, blind cats navigating obstacle courses, deaf cats playing enthusiastically, and wheelchair cats zooming around. If your cat becomes disabled, don't assume euthanasia is the only option. Give them time to adapt, provide support, make necessary modifications, and you might be amazed at what they can do. Cats are resilient, resourceful, and remarkably tough. That said, not every disability is compatible with quality of life. Severe, untreatable pain, complete inability to eat, drink, or eliminate, even with intervention, profound suffering that can't be managed. These situations might warrant different decisions. Only you and your vet can assess your individual cat situation. But please, don't assume disability equals suffering. For many cats, it simply equals different, and different can still be wonderful. Section 5. Feral and semi-feral cat socialization. Let's talk about one of the most challenging, frustrating, and ultimately rewarding aspects of cat care: socializing cats who've never learned to trust humans. These are feral cats, born and raised without human contact, who view people as predators. Or semi-feral cats, who had some early socialization but not enough, or who've been living on the streets so long they've reverted to wild behavior. Maybe you've trapped a feral cat from a colony. Maybe you've rescued a semi-feral kitten. Maybe you adopted what you thought was a shy cat and discovered they're actually terrified of humans and hide under furniture 23 hours a day. Whatever the situation, you're facing a cat who doesn't trust you, doesn't want to be touched, and might hiss, scratch, or bite if you try to interact. Here's what you need to understand. Socialization is possible, but it's not guaranteed. Success depends on the cat's age, their history, how much early socialization they received, and their individual personality. Kittens under 12 weeks can almost always be socialized. Kittens between 12 weeks and 6 months have a good chance. Cats over 6 months become progressively harder, and adult feral cats who've had zero positive human contact may never become fully social. But many semi-feral and even some feral cats can learn to trust, to tolerate touch, and sometimes even to seek affection. It takes time, patience, consistency, and realistic expectations. We're going to cover how to assess whether a cat is truly feral or just frightened, the socialization process, step by step, TNR, which is Trap, Neuter, Return for community cat management, working with semi-feral kittens, managing feral cats who can't be socialized, and success stories to show you what's possible. First, let's distinguish between feral, semi-feral, and scared domestic cats, because the approach differs. A feral cat has had no positive human contact, especially during the critical socialization window from 2 to 7 weeks of age. They view humans as dangerous predators. They hide, run, hiss, or attack if cornered. They show no recognition that humans provide food or safety. They're wild animals who happen to be the same species as domestic cats. A semi-feral cat has had some human contact but not enough to be fully socialized. Maybe they were born outside but someone fed them occasionally. Maybe they were abandoned as kittens and survived on the streets. They're wary of humans but might approach for food. They might tolerate limited interaction but panic if you try to touch them. A scared domestic cat is fully socialized but traumatized or in an overwhelming situation. These cats have lived with humans before. They know that people aren't inherently dangerous, but right now they're terrified. This might be a shelter cat overwhelmed by the environment, a cat who's been abused, or a cat adjusting to a new home. Scared domestic cats usually socialize much faster than feral cats once they feel safe. How do you tell the difference? Body language provides clues. Feral cats crouch low, ears flat, ready to run or fight. They avoid eye contact or stare with dilated pupils. They don't meow at humans. Feral cats rarely vocalize toward people. If cornered, they attack viciously out of terror. Scared domestic cats might hide but often make eye contact eventually. They might meow, seeking reassurance. Their body language softens over time. They show curiosity about humans even while scared. Semi-feral cats fall somewhere in between. They might approach for food but freeze if you move toward them. They watch you from a distance. They show conflict between curiosity and fear. Assessment also involves history if available. Where did the cat come from? Were they trapped from a feral colony? Found on the streets? Surrendered by an owner? The more you know about their background, the better you can predict socialization potential. Now let's talk about TNR, Trap, Neuter, Return, because this is the ethical framework for managing feral cat colonies. TNR involves humanely trapping feral cats, having them spayed or neutered and vaccinated, ear tipping, which is removing the tip of one ear to mark them as altered, and returning them to their colony location. TNR prevents population growth. Feral cats continue living outdoors but can't reproduce. Over time, the colony size decreases naturally as cats age and pass away without new kittens being born. TNR also improves cat welfare. Altered cats are healthier, fight less, roam less, and don't experience the stress of heat cycles or mating. caretakers provide food, water, and shelter to TNR colonies. This isn't the same as socializing cats. These cats remain feral, living outdoors, but with management to prevent suffering and population growth. If you trap a feral cat and the vet determines they're healthy and not suitable for socialization, returning them to their original location after TNR is often the kindest option. Feral cats who've lived outdoors all their lives suffer tremendously if confined indoors. They're stressed, depressed, and miserable. Outside in their familiar territory, they thrive. But sometimes you trap a cat who seems feral but is actually semi-feral, or even a scared domestic cat. Or you trap young kittens who can be socialized. This is where the socialization process comes in. Step 1 is confinement in a small, quiet space. A bathroom, spare bedroom, or large dog crate works. The space needs to be small enough that the cat can't avoid you entirely, but large enough for a litter box, food, water, and hiding spot. Provide a covered bed or box where the cat can hide. This is their safe space. For the first few days, leave the cat alone except for necessary care. Change litter, refresh food and water, but minimize interaction. Let them decompress from the trauma of trapping and adjust to the confined space. Talk to the cat softly whenever you enter the room. Don't stare directly at them. Move slowly and calmly. Your presence should become predictable and non-threatening. Step 2 is building positive associations through food. Food is the most powerful motivator for socializing feral cats. Start by placing food in the room and leaving. The cat eats when you're gone, associating your scent and presence with food appearing. Gradually, stay in the room while the cat eats. Sit on the floor, not too close, doing something quiet like reading on your phone. Don't watch the cat directly. Let them eat while you're present, but clearly not threatening. Over days or weeks, move closer during feeding times. Eventually, you're sitting near the food bowl while they eat. This takes patience. If the cat won't eat with you nearby, you've moved too fast. Go back a step. Step 3 is introducing touch, but only when the cat is ready. Signs of readiness include the cat approaching you for food without hesitation, making brief eye contact, or showing curiosity by watching you instead of just cowering. Use a long object first, not your hand. A spoon, a back scratcher, or a cat toy on a wand. Gently touch the cat's back or head while they're eating. Keep it brief, 1 or 2 touches. If they don't react badly, do it again next feeding. The goal is to desensitize them to touch. Touch predicts food and safety, not pain or danger. Over time, they tolerate touch. Eventually, they might even lean into it. Once the cat tolerates object touch, try gentle finger touches. Extend one finger, let them sniff it, then lightly scratch their head or chin. Keep sessions short. Don't push. Step 4 is expanding interaction beyond feeding. Spend time in the room just existing. Read, work on your laptop, talk softly to the cat. Your presence should become normal, not scary. Try interactive play. A feather wand or string toy often engages even fearful cats because it taps into their prey drive. Play creates positive association and builds trust. A cat who plays with you is relaxing around you. Step 5 is gradual space expansion. Once the cat tolerates your presence, accepts touch, and interacts with you in the confined space, you can slowly expand their access. Open the door to the rest of the house for short supervised periods. Don't force exploration. Let the cat decide when they're ready to venture out. Provide hiding spots throughout the house so they always have escape routes. This entire process can take weeks for young kittens, months for semi-feral cats, and 6 months to a year or more for adult feral cats if socialization succeeds at all. Progress is non-linear. There will be setbacks. The cat might regress to hiding after a loud noise scares them. Be patient. Realistic expectations are critical. A successfully socialized feral cat might never be a lap cat. They might tolerate being in the same room as you and even accept petting but never seek it out. They might always be startled by sudden movements or new people. That's okay. Socialization success doesn't mean the cat becomes indistinguishable from a cat raised by humans from birth. It means the cat can live comfortably in a home and trust at least one person. Some feral cats never fully socialize. After months of effort, they remain terrified. They hide constantly, refuse touch, and show no improvement. At that point, you have choices. Return them to their outdoor colony if they came from one and were part of a TNR program. Find a barn or farm placement where they can live as working cats, controlling rodents without needing to be social. Or create a sanctuary setup where they live confined but safe, with food and shelter, even if they never bond with humans. Euthanasia is sometimes considered for feral cats who can't be socialized and have no appropriate placement, but most rescuers and TNR organizations strongly oppose this. Feral cats aren't suffering just because they're feral. They're wild animals. They can live good lives outdoors or in sanctuary situations. Semi-feral kittens under 4 months have excellent socialization potential. The process is similar but usually faster. Kittens are more adaptable, less entrenched in fear, and often socialize within weeks. The key with kittens is handling them frequently once they tolerate touch. Gentle, brief handling sessions multiple times daily help them accept human contact as normal. Expose them to household sounds, other pets if appropriate, and different people, so they generalize their trust. Play is especially effective with kittens. They're naturally playful, and interactive play builds trust quickly. A kitten who chases a feather wand with you is learning that humans are fun. Socialized feral kittens often become wonderful pets, indistinguishable from cats, raised by humans. By the time they're 6 months old, you might never know they were feral. Now let's talk about safety, because feral and semi-feral cats can be dangerous if mishandled. They bite and scratch when threatened. Their bites often become infected because cat mouths carry bacteria. Deep scratches can also cause infection. Always use thick gloves when handling unsocialized cats, especially for trapping or vet visits. Have cat bite protocol ready. Wash thoroughly with soap and water, apply antibiotic ointment, and watch for signs of infection like redness, swelling, or red streaking. Cat bites that swell or show infection need medical attention. Don't mess around with infected cat bites. Use humane traps for catching feral cats, not your hands. Never corner a feral cat or put them in a situation where they feel they have no escape. Scared cats fight viciously. For vet visits, use a secure carrier. Some feral cats can be transferred from trap to carrier. Others need sedation just to be examined safely. Discuss with your vet beforehand. Here are some success stories to show you what's possible. A kitten trapped at 4 weeks old, hissing and spitting, socialized within 3 weeks and became a snuggly lap cat. An 8-month-old semi-feral cat took 6 months of daily work, but eventually learned to seek petting and even slept on her owner's bed. An adult feral cat trapped at 2 years old never became fully social, but after a year, learned to eat while her caretaker was in the room, tolerate limited petting during feeding, and lived contentedly as an indoor cat who preferred solitude but no longer feared her human. Not every story has a happy ending. Some feral cats remain too fearful despite months of effort. Some can't adapt to indoor life. Some are returned to outdoor colonies where they live out their lives as wild cats. But many cats who seem impossible at first surprise you. That hissing ball of fury in the trap becomes a cat who purrs when you enter the room. That cat who hid under the bed for a month becomes a cat who cautiously approaches for treats. Progress happens in tiny increments, but it happens. If you're working with a feral or semi-feral cat, remember patience, consistency, realistic expectations, and prioritizing the cat's welfare over your desire for a cuddly pet. Some cats will never be cuddly, and that's okay. A cat who lives safely indoors, eats well, uses the litter box, and doesn't live in constant terror is a socialization success, even if they never sit on your lap. Socializing feral cats is hard work. It's emotionally draining. You invest months and might not see the results you hoped for. But for those who succeed, the reward is profound. You've taken a wild animal who viewed you as an enemy and built trust. You've given a cat a safe home who might have died on the streets. And sometimes, just sometimes, You end up with an incredible bond born from patience and respect. If you're considering working with feral cats, go in with eyes open. Educate yourself, connect with experienced rescuers, and be honest about what you can handle. Not everyone is suited for this work, but for those who are, it's deeply meaningful. Section 6, Cat Behavior Modification. Advanced. Let's talk about behavior problems that go beyond the basics we covered in Part 1. We're not talking about a cat who occasionally scratches furniture or knocks things off counters. We're talking about serious behavioral issues that affect quality of life, threaten the cat's place in the home, or put people and other pets at risk. Aggression that's escalating, compulsive disorders that dominate the cat's life, severe anxiety that prevents normal functioning, inter-cat aggression that's turned a multi-cat household into a war zone. These are the cases where standard advice doesn't work, where just ignore the behavior or give them more attention fails completely, where you've tried everything you can think of and nothing has helped. These are the situations that often end with cats being surrendered to shelters or euthanized, not because they're bad cats, but because their humans don't know how to help them. We're going to dive deep into advanced behavior modification, the different types of aggression, and how to address each one specifically, counter-conditioning and desensitization protocols that actually work, case studies walking through real behavioral problems and their solutions, when to call in a professional behaviorist and what that process looks like, and how to know when a behavior problem is truly unsolvable versus just really difficult. Let's start with aggression, because this is the behavioral issue that scares people most and causes the most rehoming and euthanasia. But here's what you need to understand. Aggression is not a single behavior with a single cause. There are multiple types of aggression, each with different triggers, different underlying motivations, and different solutions. Treating all aggression the same way is like treating all diseases with the same medication. It doesn't work. Play aggression is common in young cats, especially those who were orphaned or separated from their mothers and litter mates too early. These cats never learned bite inhibition, the understanding that biting hurts and should be controlled during play. They stalk your feet, pounce on your legs, bite your hands, and scratch during interaction, all with the excited energy of play rather than genuine anger or fear. Play aggression looks different from real aggression. The cat's body language is loose and bouncy, not tense. Ears are forward, not back. Pupils might be dilated from excitement, but the cat isn't hissing or growling. After biting or scratching, they might run away and then approach again, inviting more play. They're not trying to hurt you. They're playing the way they would with another cat, not understanding that human skin is more delicate. The solution is redirecting the behavior, not punishing it. Never use your hands or feet as toys. If the cat attacks your hand, freeze and make a high-pitched yelp or hiss sound. This mimics what a kitten does when play gets too rough, signaling the cat to back off. Then redirect to an appropriate toy. Keep interactive toys nearby so you can immediately offer an alternative when play aggression starts. Provide adequate play opportunities. Cats with play aggression often have pent-up energy and a strong prey drive with no appropriate outlet. 2 or 3 vigorous play sessions daily with feather wands, laser pointers followed by catchable toys, or other interactive play can dramatically reduce play aggression. Petting-induced aggression, also called overstimulation aggression, occurs when a cat who seems to be enjoying petting suddenly bites or scratches. The cat might be purring, appearing relaxed, then without warning they attack your hand and run off. This confuses and frustrates owners who feel betrayed. The cat seemed happy, then turned on them. What's actually happening is overstimulation. Cats have a threshold for how much sensory input they can tolerate. Petting creates stimulation. Initially, it's pleasant, but it accumulates. When the cat reaches their threshold, it becomes overwhelming or even painful, like when someone tickles you until it stops being fun and becomes irritating. Most cats give warning signs before they bite from overstimulation, but the signs are subtle and easy to miss. Tail twitching, starting slowly then increasing in speed, ears rotating backward slightly, skin rippling along the back, pupils dilating, shifting body position, tensing muscles. If you see these signs, stop petting immediately. Give the cat space. Let them calm down. Prevention involves learning your cat's tolerance threshold and staying well under it. If your cat tolerates 3 minutes of petting before showing warning signs, stop at 2 minutes. End the session before they become overstimulated. Over time, short sessions that end positively can actually increase their tolerance. Some cats have very low thresholds. They tolerate only seconds of petting before becoming overstimulated. For these cats, brief touches rather than extended petting sessions might be all they ever accept. That's okay. It's not a failure on your part. It's their individual temperament. Fear-based aggression is defensive. The cat is scared and fighting because they see no other option. This is the cat who attacks the vet because they're terrified. The cat who bites when cornered under furniture. The cat who lashes out when you try to put them in a carrier. They're not being mean. They're panicking. Fear-based aggression requires addressing the underlying fear through systematic desensitization and counter-conditioning, which we'll discuss in detail shortly. The immediate management involves never putting the cat in situations where they feel trapped. Always provide escape routes. Don't corner them. Don't force interaction when they're scared. Territorial aggression occurs when a cat perceives a threat to their territory. This might be directed at other cats, other pets, or even humans. The aggressor is defending what they consider their space. In multi-cat households, territorial aggression can be directed at a cat who's lived there for years, but suddenly the aggressor decides they're no longer welcome. Territorial aggression toward other cats requires environmental management. Increase resources, add more litter boxes, feeding stations, resting areas, and distribute them throughout the house so no single cat can guard all of them. Create vertical territory with cat trees and shelves so cats can avoid each other spatially. Sometimes complete separation and reintroduction, treating them as if they're meeting for the first time, is necessary. Redirected aggression is particularly frustrating because the target is innocent. The cat becomes aroused or agitated by one thing, a cat outside the window, a loud noise, whatever, but can't attack or escape from the trigger. When another cat or a human approaches, the aroused cat redirects their aggression onto the approachable target. After a redirected aggression incident, the aggressor often associates the victim with the aroused state, creating ongoing problems. The cats might have been best friends, but now the aggressor attacks the victim on sight. Managing this requires separating the cats completely, blocking visual access to the trigger that caused the initial arousal, and doing a slow reintroduction as if they've never met. Idiopathic aggression is aggression with no identifiable trigger. The cat attacks unpredictably, without warning, without apparent reason. This is rare and genuinely dangerous because you can't predict or prevent attacks. Idiopathic aggression sometimes has neurological causes, brain tumors or seizure disorders, and requires thorough veterinary workup, including potentially brain imaging. Sometimes medication can manage it, but honestly, idiopathic aggression has a poor prognosis. These cats are dangerous, and sometimes euthanasia is the only safe option. Now let's talk about counter-conditioning and desensitization, the two core behavior modification techniques that work for fear, anxiety, and many types of aggression. These sound complicated, but the concepts are straightforward. Desensitization means gradually exposing the cat to the trigger at low enough intensity that they don't react, then very slowly increasing intensity over time until they can tolerate the full-strength trigger without fear or aggression. The key is staying below the threshold where the cat reacts. If you push too far too fast, you make the problem worse. Example, a cat is terrified of the carrier. Desensitization starts with just having the carrier in the room, door open, not trying to put the cat in it. The cat can investigate or ignore it. Once the cat is completely comfortable with the carrier's presence, you start placing treats inside. Cat goes in voluntarily to get treats, then comes out. No door closing, no trapping. Gradually, over days or weeks, you build up to the cat entering the carrier willingly. Then you close the door for 1 second and immediately open it with treats. Then 2 seconds, then 5. Then you pick up the carrier for 1 second. Eventually, you've desensitized them to the entire process. Counter-conditioning pairs the scary trigger with something positive. Every time the trigger appears, something the cat loves happens. Over time, the cat's emotional response changes from fear to anticipation, or at least neutrality. Example: a cat is aggressive toward visitors. Counter-conditioning involves having visitors toss high-value treats to the cat from a distance the cat can tolerate. The cat doesn't have to approach or interact. Visitor appears, treats rain down. Visitor leaves, treats stop. Over many repetitions, the cat starts associating visitors with treats. Their emotional response shifts from threat to treats. Combining desensitization and counter-conditioning is most effective. You gradually increase exposure while maintaining positive associations. This requires patience and consistency. You can't skip steps or rush the process. Let's walk through a detailed case study. A cat named Shadow developed severe aggression toward one specific family member after a traumatic vet visit. The family member had taken Shadow to the vet, where painful procedures occurred. Shadow now attacks this person on site, even though they'd been bonded before. The family is considering rehoming Shadow. The behaviorist assessed the situation. Shadow shows no aggression toward other family members, indicating the aggression is specific to this person and the trauma they've become associated with. This is fear-based aggression, linked to a traumatic event. The protocol? Complete separation initially. The targeted family member doesn't interact with Shadow at all for 2 weeks. Shadow decompresses, and the association between this person and the trauma starts to fade slightly. Meanwhile, other family members maintain Shadow's normal routine, demonstrating that Shadow isn't generally aggressive. Next phase. The targeted person feeds Shadow, but not directly. They place the food bowl in the room and immediately leave before Shadow sees them. Shadow eats, associating the person's scent with food but not having to encounter them. This continues for a week. Phase 3. The person sits in a room far away from Shadow while Shadow eats. They don't look at Shadow, don't try to interact, just exist in the periphery. If Shadow won't eat or shows aggression, the person is too close. They move farther away. Gradually, over weeks, they move closer. Phase 4. Once Shadow tolerates the person's presence during meals, brief non-feeding interactions begin. The person sits in the living room reading. Shadow is also in the room, resting on a cat tree. No eye contact, no direct interaction, just coexistence. Duration increases gradually. Phase 5. Indirect positive interaction. The person operates a feather wand toy from across the room. Shadow plays. Play creates positive association without requiring close contact or touch. Phase 6. The person extends one finger for Shadow to sniff from a distance. No forced petting. If Shadow approaches and sniffs, they get treats. Slowly, over many sessions, the person can offer gentle touches. This process took 4 months. But by the end, Shadow no longer attacked this family member. They weren't as bonded as before, but they coexisted peacefully. Shadow tolerated petting, and sometimes even approached for treats. The aggression was resolved enough that rehoming wasn't necessary. Another case study. A cat named Whiskers developed compulsive over-grooming, creating bald patches and skin lesions on her abdomen and flanks. Medical causes were ruled out. The diagnosis was psychogenic alopecia, compulsive grooming triggered by anxiety. Investigation revealed the anxiety stemmed from a new cat in the household who bullied Whiskers. The new cat guarded resources, chased Whiskers, and generally made her feel unsafe. The grooming was a stress response. The solution required addressing the underlying anxiety by managing the multi-cat dynamics. Resources were distributed throughout the house. The new cat was confined part-time to give Whiskers safe access to all areas. Play therapy provided stress relief. Feliway diffusers created calming pheromone signals, and Whiskers was started on fluoxetine to reduce anxiety enough that she could stop the compulsive behavior. Within 6 weeks, the over-grooming decreased significantly. Within 3 months, her fur grew back. The compulsion broke once the underlying stress was addressed. These cases demonstrate important principles. First, identify the root cause. Surface behaviors are symptoms. If you only address the symptom without fixing the underlying issue, the problem persists or manifests differently. Second, behavior modification takes time, weeks or months, not days. Third, sometimes medication is necessary to break behavioral patterns enough that modification can work. Fourth, professional help from a veterinary behaviorist is invaluable for complex cases. When should you seek professional help? When the behavior is dangerous. Serious aggression that's causing injuries needs professional assessment. When you've tried standard interventions and nothing works. When the behavior is worsening despite your efforts. When you're considering rehoming or euthanizing because of the behavior. When the problem affects multiple areas of the cat's life or the household's function. Veterinary behaviorists are vets with specialized training in animal behavior. They can prescribe medication, which is important because many behavioral issues benefit from pharmaceutical support. They create comprehensive behavior modification plans tailored to your specific cat. Finding a behaviorist. The American College of Veterinary Behaviorists website lists board-certified specialists. They're expensive, consultations often cost several $100s, but for serious cases, they're worth it. Some do remote consultations via video, making them accessible even if none practice near you. What to expect? You'll complete a detailed behavioral history questionnaire. The behaviorist will interview you, possibly observe the cat via video, and analyze the situation. They'll create a written behavior modification plan with specific protocols. Follow-up appointments track progress and adjust the plan as needed. Some behavioral problems are genuinely unsolvable or so difficult that most people can't manage them. Severe idiopathic aggression with neurological causes. Compulsion so entrenched that the cat injures themselves despite intervention. Anxiety so profound that quality of life is terrible, even with medication and environmental management. These cases are heartbreaking because you want to help, but can't. Sometimes the kindest option is euthanasia, not because the cat is bad, but because they're suffering, and nothing you do relieves that suffering. This decision should be made in consultation with your vet and ideally a behaviorist, not in frustration or anger. But most behavioral problems are solvable, or at least manageable. Aggression can be reduced, anxiety can be controlled, compulsions can be broken. It requires correct diagnosis, appropriate intervention, time, consistency, and sometimes pharmaceutical support. But it's possible. If you're dealing with a serious behavioral issue, don't give up immediately. Get professional assessment, rule out medical causes, try behavior modification with realistic expectations, but also recognize your limits. You can't save every cat, and some situations aren't safe or sustainable. The cats who respond to behavior modification, the aggressive cat who becomes tolerant, the anxious cat who relaxes, the compulsive cat who stops injuring themselves, these transformations are incredible. You've given a cat a second chance. You've prevented surrender or euthanasia. You've improved both your life and theirs. Behavior modification is hard work. It's technical, requires patience, and tests your commitment. But for cats whose behaviors threaten their place in your home, it's worth trying. Because behind every behavioral problem is a cat who's struggling, scared, frustrated, or confused, and with the right approach, many of them can learn better ways to cope. Section 7. Medication Administration Mastery. Let's talk about something that strikes fear into the hearts of many cat owners: giving medication. Your vet hands you a bottle of pills or a syringe of liquid and says, "Give this twice daily," and you're standing there thinking, "How exactly am I supposed to do that? My cat won't even let me trim their nails, and now I'm supposed to shove pills down their throat?" I get it. Medicating cats is intimidating. Cats don't understand that the medication helps them. They don't cooperate willingly. They fight, squirm, hide, and sometimes bite or scratch. And if you do it wrong, you stress your cat, get hurt yourself, and the medication ends up on the floor instead of in your cat. But here's what I want you to know. Medication administration is a skill, and like any skill, it can be learned. Thousands of cat owners successfully medicate their cats daily. Some are giving insulin injections. Others are administering eye drops to struggling cats. Some are pilling cats who hate it. And they're doing it confidently because they learned the techniques. We're going to master medication administration in all its forms. Pills and tablets, multiple different techniques, so you can find what works for your cat. Liquid medications, and how to syringe them without drowning your cat. Subcutaneous injections for fluids, insulin, or other injectable medications. Eye drops and ointments. Ear medications. Transdermal medications that absorb through the skin. Tools and tricks that make everything easier. And what to do when your cat absolutely refuses, including compounding options that turn pills into flavored liquids or treats. By the end of this section, you'll have the knowledge and confidence to medicate your cat safely and effectively. Let's start with the most common and most dreaded, pills. Pilling a cat, giving them a tablet or capsule orally, has a reputation for being impossible. And yes, some cats are extremely difficult to pill, but most cats can be pilled successfully if you use the right technique. There are multiple approaches, and different cats respond to different methods. The direct pilling method is the classic approach. Hold the pill between your thumb and index finger of your dominant hand. Use your non-dominant hand to hold the cat's head from above, placing your thumb on one side of the jaw and fingers on the other, behind the whiskers. Tilt the cat's head back gently. Their jaw will naturally open slightly. Use the middle finger of your dominant hand, the one holding the pill, to push down on the lower jaw, opening the mouth wider. Quickly place the pill as far back on the tongue as possible, ideally past the hump of the tongue. Close the cat's mouth, hold it closed, and gently stroke their throat or blow on their nose. This stimulates the swallow reflex. Watch to make sure they swallow. Sometimes cats hold pills in their mouth and spit them out minutes later. This technique works but requires confidence and speed. If you hesitate, the cat squirms away. Practice the motion with a treat first so your cat gets used to the process without the stress of actual medication. The pill pocket method uses commercial treats with a hole designed to hold pills. You insert the pill, seal the treat around it, and offer it to your cat as a regular treat. Many cats eat it willingly, swallowing the pill without realizing it's there. This is by far the easiest method when it works. The limitations are that some cats refuse pill pockets or learn to eat around the pill, leaving it behind. And pill pockets are relatively expensive for long-term daily medication. The food hiding method involves crushing the pill. If it's safe to crush, check with your vet or pharmacist, as some medications can't be crushed, and mixing it into a small amount of wet food or a high-value treat like tuna or baby food meat. Use only a tiny amount of food so the cat eats all of it and gets the full dose. This works well for cats who are food motivated and don't detect the medication. The butter method exploits cats' grooming instinct. Coat the pill in butter or a small amount of cream cheese. When the cat licks it off their lips or paws, the pill goes down with it. Or place the butter-coated pill on the cat's nose or paw, they'll lick it off to groom themselves, swallowing the pill in the process. The compounding method, which we'll discuss more later, turns pills into flavored liquids, transdermal gels, or treats formulated specifically for your cat. Pill guns or pet pillars are plastic devices that hold the pill and allow you to place it far back in the cat's throat without putting your fingers in their mouth. Some people find these easier and safer than finger pilling. Others find them awkward. It's personal preference. Two-person pilling is sometimes necessary for difficult cats. One person restrains the cat gently but firmly, often wrapping them in a towel burrito style with just the head exposed. The second person administers the pill. This is less stressful than fighting with the cat alone. Common pilling mistakes include not placing the pill far enough back, allowing the cat to spit it out, not watching to confirm the swallow so the cat spits it out later, using too much food to hide crush pills, so the cat doesn't eat all of it and gets only a partial dose. Crushing pills that shouldn't be crushed, which can alter their effectiveness or release mechanism, and creating negative associations by being too forceful or stressful, making future pilling harder. Now, liquid medications. These come in bottles or syringes and are measured in milliliters. You'll use a syringe without a needle to draw up the dose and squirt it into your cat's mouth. Never give liquid medication to a cat with their head tilted back. This can cause the liquid to go into the lungs instead of the esophagus, causing aspiration pneumonia. The correct technique: hold the cat's head level or tilted down slightly. Insert the syringe tip into the side of the mouth, between the cheek and teeth, not down the center of the throat. Slowly depress the plunger, giving the cat time to swallow. If you go too fast, liquid spills out or they choke. Pause between small squirts. A 1 milliliter dose might be given in 3 or 4 small squirts rather than all at once. Most cats tolerate liquid medication better than pills if it's done correctly. The key is slow, steady administration and positioning the syringe correctly. Some cats try to back away or turn their heads. Gentle but firm restraint helps. Again, 2-person administration or a towel wrap can make this easier. Flavoring liquid medications, if the compounding pharmacy offers it, can help. Chicken, tuna, or beef flavoring makes medicine more palatable. Some cats still hate it, but others accept it more willingly. Now let's talk about injections, which sound terrifying but are actually one of the easiest medication administration methods once you get over the fear. Subcutaneous injections under the skin are used for fluids, insulin, some antibiotics, and other medications. We covered subcutaneous fluid administration in the kidney disease section, but let's review and expand. Insulin injections use the same basic technique, but with smaller needles and much smaller volumes. Equipment: the medication in its vial, a syringe appropriate for the medication and dose, usually insulin syringes for insulin or larger syringes for fluids or other injectable medications. Alcohol to wipe the vial top, though some vets say this isn't necessary for home use, and a sharps container for safe needle disposal. Drawing up the medication. Roll the vial gently if needed to mix. Don't shake. Remove the cap from the syringe. If the medication is in a vial, you need to inject air equal to the volume you're drawing out. Draw air into the syringe to the dose amount. Insert the needle into the vial through the rubber stopper. Inject the air. Invert the vial so the liquid is at the bottom. Draw the medication into the syringe, pulling the plunger to the correct dose. Check for air bubbles. If present, tap the syringe to move bubbles to the top, push them out, and draw a bit more medication to correct the dose. Administering the injection. Locate a site with loose skin. The scruff of the neck between the shoulder blades or along the sides of the body works. Grasp the loose skin and pull it up, creating a tent. Insert the needle into the space under the skin, not into muscle. The needle should go in easily, with little resistance. If you hit muscle or go too deep, the cat might flinch. Pull back slightly on the plunger before injecting. If blood appears, you've hit a blood vessel. Remove the needle. Choose a different site. If no blood, push the plunger steadily to inject the medication. Remove the needle. Dispose of it in a sharps container immediately. Most cats don't even notice subcutaneous injections if done correctly. The needles are small, the space under the skin has few nerve endings, and the process takes seconds. Insulin injections are so quick, many cats don't react at all. Intramuscular injections into the muscle are less common in home care, but sometimes prescribed. These are more painful than subcutaneous injections. Your vet will demonstrate the proper location, usually the large muscle of the hind leg, and technique. IM injections should only be given if specifically prescribed and after proper training. Eye drops and ointments are commonly needed for conjunctivitis, glaucoma, or post-surgery care. Administering them requires gentle restraint and correct technique. Hold the bottle or tube in your dominant hand. Use your non-dominant hand to hold the cat's head steady, tilting it up slightly. Approach from above and behind so the cat doesn't see the bottle coming, which reduces flinching. Gently pull down the lower eyelid to create a pocket. For drops, squeeze the prescribed number of drops into the pocket, aiming for the inner corner of the eye, not directly onto the eyeball. For ointment, squeeze a small ribbon of ointment along the inside of the lower eyelid. Release the cat's head. They'll blink, distributing the medication across the eye. Common mistakes: touching the tip of the bottle or tube to the eye, which can contaminate the medication or injure the eye. Giving too much medication, which runs out and is wasted. Not holding the head steady, causing missed doses. And administering too quickly after previous doses when multiple eye medications are prescribed. If your cat needs multiple eye medications, wait at least 5 minutes between different drops to prevent dilution. Ear medications treat ear infections or ear mites. Pull the ear flap up and back to straighten the ear canal. Squeeze the prescribed amount of medication into the ear canal. Gently massage the base of the ear. You'll hear a squelching sound to distribute the medication deep into the canal. Let go and allow your cat to shake their head, which is normal and helps distribute the medication. Wipe away any excess from the outer ear with a cotton ball. Transdermal medications are absorbed through the skin. These are applied to the hairless skin inside the ear flap. Wear gloves to apply transdermal medication to prevent absorption through your own skin. Wipe the inside of the ear with a tissue to remove any oils. Apply the prescribed amount of gel to the hairless skin. It absorbs over several hours. Alternate ears with each dose to prevent irritation. Methimazole for hyperthyroidism and mirtazapine for appetite stimulation are commonly given as transdermals. Topical medications include flea preventatives, wound treatments, or medicated shampoos. Follow product instructions carefully. For spot-on flea treatments, part the fur at the base of the skull where the cat can't lick and apply directly to the skin, not on top of the fur. Now let's talk about tools and tricks that make medication easier. Pill guns for cats who bite during pilling. Pill pockets or Greenie's pill pockets for hiding pills. Flavor additives for liquid medications. Compounding pharmacies that reformulate medications into forms your cat accepts better. Towel wrapping or cat restraint bags for difficult cats. Having a second person to help with restraint. Giving treats or meals immediately after medication to create positive associations. Safety considerations. Always wash your hands after handling medications, especially chemotherapy drugs or transdermals. Store medications out of reach of children and pets. Check expiration dates and discard expired medications. Follow dosing instructions exactly. Never give human medications to cats unless specifically prescribed by your vet. Many human drugs are toxic to cats. Double check which cat is receiving which medication in multi-cat households. It's surprisingly easy to mix this up. What to do when your cat absolutely refuses medication? First, communicate with your vet. Explain the difficulties. They might prescribe a different form of the medication, adjust the dosing schedule, or suggest alternatives. Compounding pharmacies can reformulate medications. Pills become flavored liquids. Liquids become transdermal gels. Some medications can even be formulated into small treat-like chews. This costs more, but dramatically improves compliance. For some medications, less frequent dosing is available. A medication that requires twice-daily pilling might have a long-acting injection alternative given weekly or monthly at the vet. This trades daily stress for occasional vet visits. Palatability enhancers or flavor compounds can be added to medications to make them more acceptable. Consider whether the medication is truly necessary or if quality of life without it might be acceptable. For end-stage disease where medication prolongs life but causes daily stress, sometimes stopping medication and focusing on comfort is kinder. This is a conversation to have with your vet. Practice and desensitization help for cats who fight medication. Practice the motions without medication, using treats instead. Reward cooperation. Build positive associations. Over time, some cats learn to tolerate medication because it predicts treats. Here's the truth. Medicating cats is rarely fun. Even with perfect technique, some cats hate it, but it's doable. Millions of cat owners medicate their cats successfully every day. You can learn this. You can get comfortable with it. And when your cat needs medication to manage diabetes, hyperthyroidism, pain, infection, or any other condition, you'll be able to provide that care. Start with the easiest method for your cat. If pills can be hidden in food, do that. If your cat accepts pill pockets, use them. If liquid is easier than pills, ask if the medication comes in liquid form or can be compounded. If injections seem easier than pilling, don't be afraid of them. Get your vet or a vet tech to demonstrate techniques. Practice with them watching until you're confident. Ask questions. If you're not sure you're doing it right, ask for a second demonstration and give yourself grace. You'll mess up sometimes. You'll drop pills. You'll squirt liquid medication on the cat's fur instead of in their mouth. You'll inject air instead of fluid or miss the vein when you're trying to do blood draws, though that's usually a vet task. It happens to everyone. Learn from it and try again. The goal isn't perfection. It's getting medication into your cat safely and with as little stress as possible for both of you. However you accomplish that, whether it's perfect pilling technique or creative food hiding or paying for compounded medications, you're succeeding. Your cat depends on you for medical care. Sometimes that means doing things they don't enjoy, but with the right techniques, tools, and mindset, you can provide that care competently and compassionately. Medication administration is a skill, and you can master it. Section 8, Post-Surgery Care Complete Guide. Let's talk about something nearly every cat owner will face at some point: caring for a cat after surgery. Whether it's a routine spay or neuter, dental surgery, mass removal, orthopedic repair, or emergency surgery for illness or injury, the post-operative period is critical. How you care for your cat in the days and weeks after surgery directly impacts their recovery, their comfort, and their outcome. Your vet will send you home with instructions, but those instructions are often brief, generalized, and don't cover every situation you'll encounter. You'll have questions at 2 in the morning when the vet's office is closed. You'll wonder if something you're seeing is normal or an emergency. You'll struggle with keeping your cat confined when they seem desperate for freedom. You'll worry about pain management, wound healing, and whether you're doing everything right. We're going to walk through comprehensive post-surgery care so you know exactly what to expect and how to handle it. We'll cover different surgery types and their specific care needs, managing the Elizabethan collar and alternatives that actually work, wound care and recognizing complications, pain management at home, and knowing when your cat needs more pain control, activity restriction, and how to actually enforce it, feeding and hydration after surgery, recognizing emergencies versus normal post-op changes, monitoring recovery progress, and long-term rehabilitation when needed. Let's start with understanding that post-operative care varies dramatically depending on the surgery type. A spay is very different from a leg amputation. Dental surgery has different concerns than abdominal mass removal. Orthopedic surgery requires different management than soft tissue surgery. Spay and neuter surgeries are among the most common. Spaying, removing the uterus and ovaries in females, is more invasive than neutering, removing the testicles in males. Spay incisions are on the abdomen, either along the midline or on the flank depending on the technique. Neuter incisions are on the scrotum, often so small they might not even have sutures. Post-spay care involves monitoring the incision for swelling, redness, discharge, or the cat licking excessively. The incision should look clean with edges together. Some bruising is normal, turning purple or yellow as it heals. A small amount of dried blood immediately after surgery is normal. Active bleeding, pus, gaps in the incision, or excessive swelling are not normal. Activity restriction is critical after spays. No jumping, running, or rough play for 10 to 14 days. This is harder than it sounds because cats, especially young ones, feel fine within a day or two and want to play. But internal sutures need time to heal. Excessive activity can cause complications, including hernias, where the abdominal wall doesn't heal properly. Confine your spayed cat to a small room or large crate. Provide everything they need: litter box, food, water, comfortable bed, in one accessible space. No cat trees, no furniture to jump on. This seems cruel, especially when your cat is meowing to be let out, but it's temporary and necessary. Neuters are less invasive. Most male cats recover within days and don't require strict confinement. Monitor the incision site for swelling or excessive licking. Some cats barely seem to notice they had surgery. Dental surgery post-op care focuses on the mouth. Your cat might have had teeth extracted, deep cleanings, or treatment for oral disease. Their mouth will be sore. Soft food only for several days, sometimes weeks if multiple extractions occurred. If your cat only eats dry food normally, you'll need to transition them to canned or moistened kibble. Some bleeding from the mouth is normal immediately after dental surgery. Blood-tinged saliva, pink-tinged drool, or small amounts of blood when eating are expected. Heavy bleeding, constant drooling, or inability to eat are not normal. Pain management is especially important after dental surgery. Cats can't tell you their mouth hurts, but refusal to eat, pawing at the mouth, or excessive drooling indicate pain. Make sure you have pain medication and use it as prescribed. Orthopedic surgery, repairing broken bones, ligament tears like cruciate repairs, or joint surgeries, requires intensive post-op care. Activity restriction is absolute. A cat who uses a repaired leg too early can undo the surgery, displacing hardware, tearing repair sites, or causing non-union where the bone doesn't heal. Crate rest might be recommended for weeks. This means 24-hour confinement to a space just large enough for the cat to stand, turn around, and lie down. It's emotionally difficult for both cat and owner, but it's necessary for surgical success. Physical therapy might be recommended as healing progresses. Range of motion exercises, controlled leash walking, even underwater treadmill therapy at specialty rehab centers. Your vet or a veterinary physical therapist will guide you through appropriate exercises and timelines. Amputation recovery depends on which limb and the cat's overall health. We discussed three-legged cats earlier. Post-amputation, pain control is critical for the first several days. The cat learns to balance on three legs gradually. Initially, they're wobbly and reluctant to move. By a week, most are navigating confidently. By 2 weeks, they're nearly back to normal activity. Mass removal or lumpectomy, post-op care depends on the location. Skin masses are relatively straightforward. Internal abdominal masses require more intensive care, similar to spay recovery. Now let's talk about the Elizabethan collar, the cone of shame, the plastic lampshade cats are forced to wear to prevent them from licking or chewing at surgical sites. Cats hate them. They're clumsy, uncomfortable, and prevent normal grooming, eating, and moving through spaces, but they're necessary if your cat won't leave. The incision alone, licking delays healing, introduces bacteria, can remove sutures and causes infections or dehiscence where the incision opens. Traditional hard plastic e-collars work but have major downsides. Cats bump into everything. They can't reach their food bowls easily. Some refuse to eat or drink while wearing them. They're stressed and miserable. Alternatives exist. Soft fabric e-collars are more comfortable and less rigid. They still prevent the cat from reaching the surgical site but are less cumbersome. Inflatable donut collars fit around the neck like a travel pillow. They prevent the cat from curling around to reach their body but don't block forward vision. Some cats tolerate these better. Surgical recovery suits are fabric onesies that cover the abdomen or surgical site. They prevent direct access to incisions without the head cone. Many cats tolerate suits well, though some figure out how to wiggle out of them. The best option depends on your cat and the incision location. For abdominal incisions, suits often work well. For leg or paw surgeries, e-collars might be necessary. For facial or neck areas, you might have no choice but a traditional collar. Some cats don't need protection devices at all. If your cat ignores the incision completely, you might skip the collar. Monitor closely for the first day. If they start licking excessively, add protection. Adjusting food and water bowls helps cats eating in e-collars. Elevate bowls so the collar rim doesn't hit the floor. Use wide, shallow dishes instead of deep bowls. Hand feeding for the first day or two helps some cats adjust. Wound care varies by surgery type. Most surgical incisions don't need active care beyond monitoring. Don't apply anything to the incision unless your vet specifically instructs you to. No hydrogen peroxide, no neosporin, no cleaning unless directed. These can irritate the incision and delay healing. If drains are placed, thin tubes extending from the surgical site to allow fluid drainage, you'll need to monitor output and possibly clean around the drain site. Your vet will demonstrate proper drain care. Generally, it involves wiping around the exit site with dilute chlorhexidine solution and monitoring the amount and color of fluid draining. Drains are usually removed after a few days when drainage decreases. This is a quick procedure, often done without sedation. The vet pulls the drain out. It's uncomfortable for a moment, but not excruciating. Sutures or staples are removed 10 to 14 days post-surgery in most cases. Some surgeries use absorbable sutures that dissolve on their own and don't require removal. Your vet will tell you which type your cat has. Suture removal is quick. The vet or tech cuts each suture and pulls it out with forceps. Most cats tolerate this without sedation, though squirmy or aggressive cats might need light sedation. Pain management at home is critical. Cats are experts at hiding pain. They won't cry or whimper like dogs. Instead, they become quiet, stop eating, hide, or show subtle behavior changes. Common post-op pain medications include buprenorphine, an opioid given as oral liquid, injections, or even absorbed through the gums. It provides strong pain relief and is commonly sent home after surgery. Meloxicam or robenacoxib, NSAIDs, that reduce inflammation and pain. These must be used carefully in cats and for short durations. Gabapentin, which helps with nerve pain and has sedative effects that can help anxious post-op cats rest. Give pain medication exactly as prescribed. Don't skip doses because your cat seems comfortable. Pain management works best when maintained consistently, not given only when the cat shows obvious pain. Signs your cat needs more pain control include refusing to eat, hiding constantly, not moving or changing positions, vocalizing when touched near the surgical site, rapid breathing, dilated pupils without other cause, or aggression when normally friendly. If pain seems inadequately controlled, contact your vet. Don't just give more medication than prescribed, as overdose is dangerous. Your vet can adjust the dose, add additional medications, or switch to stronger options. Activity restriction is one of the hardest parts of post-op care because cats don't understand why they're confined, and you feel guilty seeing them unhappy. But it's non-negotiable for many surgeries. Strategies for enforcing restriction, confined to a small space where jumping and running are impossible. A bathroom, large dog crate, or small bedroom with furniture removed works. Provide enrichment that doesn't require activity, food puzzles, gentle petting if the cat enjoys it, calm talking, even just sitting in the room with them. If you must let the cat into a larger space, supervise closely and block access to high furniture. Baby gates can section off rooms. Cover furniture with boxes or boards to prevent jumping. At night, confine the cat even if you let them out during the day. Unsupervised overnight activity can undo surgical repairs. The duration of restriction varies. Neuters might need only a few days. Spays need 10 to 14 days. Orthopedic surgeries might need 4 to 8 weeks. Follow your vet's specific timeline. Feeding post-surgery can be challenging. Anesthesia causes nausea, so appetite might be poor for the first 24 hours. Offer small amounts of normal food. If your cat refuses, try highly palatable options like plain chicken, tuna, or baby food meat. Some cats vomit once or twice after surgery from anesthesia. This is usually self-limiting. If vomiting continues beyond 24 hours or is severe, contact your vet. Ensure water access. Some cats don't drink much post-op due to pain or nausea. If your cat isn't drinking and you're concerned about dehydration, offer water with a syringe. Give wet food to increase moisture intake, or contact your vet about subcutaneous fluids. Weight loss is common in the first few days post-surgery. Most cats eat less due to pain, nausea, or stress. As they feel better, appetite returns. Monitor weight if recovery is prolonged. Significant continued weight loss needs veterinary assessment. Litter box use might change post-op. Some cats urinate or defecate more frequently or have accidents due to pain medication, stress, or difficulty accessing the box while wearing an e-collar. Provide a low-entry box if jumping into a standard box is difficult. Place the box very close to where the cat is confined. Constipation is common after surgery, especially with opioid pain medications. If your cat hasn't defecated within 48 hours, contact your vet. A stool softener or laxative might be needed. Diarrhea can occur from stress, antibiotic side effects, or dietary changes. Mild diarrhea for a day or two often resolves on its own. Persistent or severe diarrhea needs veterinary attention. Now let's talk about recognizing complications versus normal post-op changes, because this is what causes the most anxiety. You're staring at your cat wondering, is this normal or should I be rushing to the emergency vet? Normal post-op changes. Mild lethargy for the first day or two. Cats sleep more and are less active. Reduced appetite for 24 hours. Occasional vomiting once or twice in the first day. Mild discomfort when moving or being touched near the surgical site. Bruising around the incision that turns purple, green, or yellow as it heals. Slight swelling immediately around the incision. This is inflammation, part of normal healing. Concerning changes that need veterinary contact, refusal to eat for more than 24 hours, severe lethargy where the cat is unresponsive or can't stand, repeated vomiting or vomiting beyond the first day, diarrhea that's bloody or continues more than a day, difficulty breathing, rapid breathing, or open mouth breathing, pale or white gums indicating anemia or shock, the incision opening up, gaps forming or tissue protruding, heavy bleeding from the incision, pus or foul-smelling discharge from the incision, severe swelling that extends beyond the immediate incision area, fever, though you might not recognize this without taking their temperature. Signs include hot ears, lethargy, and refusal to eat, inability to urinate or defecate, extreme pain that doesn't respond to prescribed medication. When in doubt, call your vet or an emergency clinic. It's better to check and be told it's normal than to wait and have a complication worsen. Take photos of the incision daily. This lets you track changes. If you call the vet concerned about the incision, you can send photos to help them assess remotely whether it's an emergency. Recovery monitoring involves tracking several parameters. Activity levels should gradually increase. By day 3 or 4, most cats are more alert and interested in their surroundings. Appetite should return to normal within 2 to 3 days. Litter box use should normalize within a few days. The incision should look progressively better, less swollen, less red, healing edges. Keep a recovery journal if you're worried about missing changes. Note daily: appetite, percentage of normal, activity level, sleeping most of the time, alert, active, litter box use, incision appearance, and any concerns. Recheck appointments are typically scheduled 10 to 14 days post-surgery. The vet examines the incision, checks healing progress, removes sutures if needed, and clears the cat for normal activity or extends restrictions if healing isn't complete. Some surgeries require follow-up imaging. Orthopedic repairs might need X-rays at several weeks to confirm bone healing. Mass removals might need follow-up ultrasounds to check for recurrence. Long-term rehabilitation applies to major orthopedic surgeries, neurological injuries, or amputations. Physical therapy helps restore function, build muscle, and prevent compensatory injuries. Rehabilitation might include passive range of motion, where you gently flex and extend joints, controlled leash walking with gradual distance increases, swimming or underwater treadmill for low-impact exercise, laser therapy to reduce pain and inflammation, and massage to improve circulation and comfort. Veterinary rehabilitation specialists create customized programs. These aren't common everywhere, but they exist in larger cities or specialty hospitals. Home exercises might be as simple as encouraging your cat to walk to their food bowl, gradually increasing the distance, or placing treats on low platforms they have to step up onto, building strength. The emotional component of post-op care is real. You'll feel guilty confining your cat. You'll question whether you made the right decision to do the surgery. You'll be stressed managing their care. This is normal. Remember why the surgery was necessary. It was to improve your cat's health, relieve pain, remove disease, or prevent future problems. The temporary discomfort of recovery is worth the long-term benefit. Your cat won't understand why they're confined or uncomfortable, but they're resilient. They don't dwell on suffering the way humans do. They live in the moment. Once they feel better, they move on. Give yourself grace. You're doing your best. If you make mistakes, missing a dose of medication or letting your cat jump once when you weren't watching, don't catastrophize. Just do better going forward. Post-surgery care is intensive but temporary. Most surgeries have recovery periods measured in days or weeks, not months. You can handle this. Your cat needs you to be calm, consistent, and attentive, and you can be that. When you're on the other side of recovery, your cat healed, active, and back to normal, you'll realize it was worth it. The stress, the confinement, the worry, it all fades. What remains is a healthier cat and the satisfaction of knowing you provided excellent post-operative care. Surgery is never fun. Recovery is challenging. But with the knowledge you now have, you can navigate it confidently, recognize problems early, manage pain effectively, and give your cat the best possible chance for a smooth, complete recovery. Section 9. Moving with Cats. International. Let's talk about one of the most stressful situations you can face as a cat owner, moving to a new home, particularly internationally. If you've ever moved locally, you know how disruptive it is for cats. They're territorial creatures who derive security from familiar spaces. Change is stressful. Now multiply that stress by the complexity of international moves, quarantines, health certificates, airline regulations, and adapting to entirely new countries. Maybe you're relocating for work. Maybe you're moving to be near family. Maybe you're retiring abroad. Whatever the reason, you're facing the challenge of transporting your cat across international borders and helping them adjust to a completely new environment, possibly in a different climate, with different dangers, and separated from everything familiar. We're going to cover everything you need to know about international moves with cats, country-specific requirements and how to research them, health certificates and veterinary documentation, rabies titers and blood tests, quarantine requirements and how to navigate them, airline regulations and choosing the right carrier, preparing your cat for travel, in-cabin versus cargo hold decisions, the actual travel day, arriving in your new country and helping your cat adjust to the new home. This is complex. International pet transport has layers of bureaucracy, strict timelines, and consequences if you get it wrong. Get one document incorrect, and your cat might be denied entry, sent back, or quarantined longer than necessary. Miss a deadline for rabies titers, and you're delayed by months. Choose the wrong airline, and your cat experiences dangerous conditions. But thousands of people successfully move internationally with their cats every year. It's doable. It just requires careful planning, attention to detail, starting early, and often professional help. Let's start with the fundamental rule of international pet transport. Every country has different requirements. There is no universal standard. What's required to bring a cat into the United Kingdom is completely different from Australia, which is different from Japan, which is different from the European Union. You cannot assume. You must research the specific requirements for your destination country. Start by visiting the official government website for your destination country's agriculture or customs department. Most countries have detailed pet import requirements published online. Look for official sources, not blog posts or forums, because regulations change and unofficial information might be outdated. Common requirements across many countries include a microchip, an ISO-compliant 15-digit chip that can be read by international scanners. The microchip must be implanted before rabies vaccination for the records to be valid in many countries. Rabies vaccination, current and documented. Some countries require specific rabies vaccines approved in that country. Others accept any WHO-approved vaccine. Timing matters. Most countries require vaccination at least 21 days before travel, but not more than a certain number of years, typically 1 to 3 years. Rabies titer test, also called a rabies antibody test, is required by many countries, particularly those that are rabies-free like the UK, Australia, New Zealand, Japan, and Singapore. This blood test confirms your cat has sufficient rabies antibodies from vaccination. Blood is drawn at least 30 days after rabies vaccination, sent to an approved laboratory, and tested. Results must show a titer of at least 0.5 IU per milliliter. Here's the catch. Many countries have a waiting period after the titer test before the cat can enter. For the UK, it's 3 months from the blood draw date, not the test result date. For Australia, it's 6 months. If you don't plan ahead, this waiting period delays your move significantly. Start the rabies titer process 6 to 12 months before your intended move date if possible. Health certificates are required universally. This is a document issued by a licensed veterinarian, often requiring endorsement by a government veterinary officer in your home country, certifying your cat is healthy and meets the destination country's import requirements. Health certificates have strict validity periods, typically 10 days. This means the final vet exam and certificate must occur within 10 days of travel. You can't get it months in advance. The process usually involves your regular vet performing a thorough health exam, completing the health certificate form specific to your destination country, signing and dating it. Then you take that certificate to a USDA office if you're in the United States, or the equivalent government veterinary office in other countries for official endorsement. This endorsement, a stamp and signature from a government vet, is what makes the certificate internationally valid. Some countries require additional testing or treatments. Parasite treatments, often for tapeworm, given within a specific time frame before travel. Japan requires treatment 1 to 7 days before arrival. Testing for specific diseases. Some countries require FIV and FELV testing. Quarantine even with all paperwork correct, which we'll discuss more later. Now let's talk about working with pet relocation specialists. For complex moves, especially to countries with strict requirements like Australia or Hawaii, professional pet relocation companies are worth the cost. They navigate the bureaucracy, ensure all paperwork is correct and filed on time, arrange flights, handle customs clearance, and manage quarantine arrangements. Costs range from $1,500 to $5,000 or more depending on destination and services. This sounds expensive, but consider the cost of mistakes. If your cat is denied entry due to incorrect paperwork, you might have to fly them back, pay for kenneling, or face extended quarantine. Professional help often pays for itself in avoided problems. If you handle it yourself, create a detailed checklist with deadlines. Work backward from your travel date. If you're moving to the UK and need a 3-month wait after the rabies titer, that titer must be done at least 4 months before travel. The rabies vaccine must be done at least 1 month before the titer. The microchip must be before the vaccine. You're looking at starting the process 5 to 6 months out minimum. Join online communities of people who've moved to your destination country with pets. Facebook groups, expat forums, and pet travel forums have people who've navigated the exact process you're facing. They can share updated information, recommend vets or relocation companies, and warn you about pitfalls. Airline regulations vary dramatically. Not all airlines accept pets. Some accept small pets in cabin only. Others allow cargo hold transport. Some have seasonal restrictions, not flying pets during extreme temperatures. Some limit the number of pets per flight. Some don't fly certain breeds. Research airlines flying your route and compare their pet policies. In-cabin travel is ideal if your cat is small enough and the airline allows it. The cat travels in a carrier under the seat in front of you. They're with you the entire time. This is far less stressful than cargo and much safer. The limitation is size. Most airlines allow carriers up to 18 inches long by 11 inches wide by 11 inches high, give or take. Cats over about 12 to 15 pounds often don't fit comfortably. You'll need an airline-approved soft-sided carrier that fits under the seat. Measure your cat. Make sure they can stand, turn around, and lie down in the carrier. Book early and pay the in-cabin pet fee, typically $100 to $200 each way. Cargo hold travel is necessary for larger cats or airlines that don't allow in-cabin pets. The cat travels in the climate-controlled cargo hold in a hard-sided, airline-approved crate. This is safe if done correctly, but it's more stressful for the cat. They're separated from you, experience noise and handling, and spend hours in a crate. Crate requirements are specific. It must be large enough for the cat to stand, turn, and lie down. It must have ventilation on multiple sides. It must have a secure door with a locking mechanism. It must have a water dish attached to the door. Some airlines require absorbent bedding. Label the crate clearly with live animal, your contact information, destination, and any special instructions. Attach a recent photo of your cat to the crate. If the cat escapes, the photo helps identification. Direct flights are always better than connections. Every connection is another chance for delays, missed transfers, or your cat being left on a hot tarmac. If you must connect, ensure sufficient layover time, at least 2 to 3 hours, so your cat's crate is transferred properly. Preparing your cat for travel involves crate training well in advance. Don't introduce the travel crate the day before the flight. Set it up weeks ahead. Feed your cat in the crate. Put treats and toys inside. Let them sleep in it. Make it a positive space, not a trap. Consider a practice run. Put your cat in the carrier and drive around for an hour, simulating some of the travel experience. See how they react. If they panic severely, talk to your vet about sedation options. Sedation is controversial. Most airlines and veterinarians advise against sedating cats for air travel. Sedation can cause respiratory depression, especially at altitude in the cargo hold. It can also make cats less able to brace themselves during turbulence, increasing injury risk. However, for extremely anxious cats, mild anti-anxiety medication like gabapentin might be appropriate. Discuss with your vet. The travel day is stressful. Arrive at the airport early. Check in your cat if they're flying cargo. For in-cabin, check in as you normally would, declaring your pet. Security might require you to remove your cat from the carrier while the carrier goes through the X-ray. Practice this at home. Some cats panic when removed from their carrier in a chaotic airport. Limit food before travel. Feed a light meal 4 to 6 hours before departure. Withhold food closer to departure to reduce the chance of vomiting or defecation in the carrier. Provide water up until departure. During the flight, if your cat is in cabin, speak to them softly. Slide your fingers into the carrier for them to smell. Stay calm. Your anxiety transfers to them. In cargo, you can't do anything but trust that the airline handles them properly. Arriving in your destination country, you'll go through customs and pet clearance. Have all your paperwork organized in a folder: health certificate, vaccination records, rabies titer results, import permit if required, and any other documents. Officials will inspect your cat, verify the microchip matches paperwork, and check that all requirements are met. If everything is in order, your cat is released to you. If there are issues, they might be held for quarantine or additional checks. This is where professional relocation services earn their money. They know how to handle these situations. Quarantine requirements exist in some countries despite perfect paperwork. Australia requires a minimum 10 days quarantine at a government facility. Cats arrive, are examined, and stay in quarantine kennels for observation. You can't visit. You can call for updates. After 10 days, if health checks are good, they're released. The UK used to have 6 months quarantine, but now has a streamlined process. If you meet all requirements, including the rabies titer and 3-month wait, there's no quarantine. Your cat enters immediately. Hawaii, even though it's a US state, has strict requirements because they're rabies-free. With all paperwork correct, including rabies titers and a waiting period, quarantine can be as short as 5 days or even direct release. Without proper documentation, it's 120 days. Research your specific destination's quarantine requirements early. Factor this into your moving timeline and budget. Quarantine isn't cheap. Australia's 10-day quarantine costs around $1,000 or more. Helping your cat adjust to the new home after arrival is the final piece. Set up a safe room before your cat arrives. One room with their litter box, food, water, familiar bedding, and toys. This will be their home base while they adjust. When you first bring your cat into the new house, take them directly to this room. Open the carrier and let them emerge on their own. Don't force them out. They'll likely hide initially. That's normal. Spend time in the room with them. Sit on the floor, read, talk softly. Let them approach you when ready. Feed them in this room. Play with them. Make it positive. After a few days to a week, once they seem comfortable in the safe room, crack the door open. Let them explore the rest of the house at their own pace. They might venture out tentatively, then run back to their safe room. That's fine. Gradual exploration builds confidence. Don't change everything at once. If possible, bring familiar items from the old home, their favorite bed, scratching post, toys. Scent is important. Familiar smells reduce stress. If you've moved to a different climate, consider how it affects your cat. Moving from a cold climate to a hot one means your cat might struggle with heat. Provide air conditioning, fresh water, and shaded areas. Moving from hot to cold means they might seek warmth. Provide heated beds or warm spaces. Indoor-outdoor considerations matter. If your cat was indoor-outdoor before, assess the safety of allowing outdoor access in the new location. Different countries have different dangers, traffic patterns, predators, diseases, or even cultural attitudes toward cats. Many expats keep previously outdoor cats indoors in their new country due to these risks. Adjusting to new dangers includes different wildlife, toxic plants native to the region, different diseases endemic to the area, and building hazards if you're in an apartment versus a house. Veterinary care setup is essential. Before you move, research vets in your destination city. Expat communities can recommend English-speaking vets if you're moving to a non-English-speaking country. Register with a vet soon after arrival. Don't wait for an emergency. Language barriers can complicate vet care. Consider learning basic veterinary terms in the local language. Bring a translation app to appointments if needed. Cost of veterinary care varies dramatically by country. The U.S. is often more expensive than many other countries. The U.K., Australia, and some European countries have higher costs. Research costs, so you're not surprised. Pet insurance considerations matter. If you have pet insurance, check if it covers international moves and vet care in your new country. Many don't. You might need to find new insurance in your destination country. Emotional adjustment is real for cats. Some adapt within days. Others take weeks or months. Signs of adjustment include exploring the house confidently, eating normally, using the litter box reliably, playing and showing affection. Signs of poor adjustment include hiding constantly, refusing to eat, aggression, or eliminating outside the box. For cats struggling to adjust, pheromone diffusers like Feliway can help. Maintain consistent routines, spend extra time with them, be patient. Moving is traumatic for cats, but most eventually settle. Here's a real timeline example for moving from the US to the UK. Month 6 before move. Ensure microchip is ISO compliant. If not, get one. Ensure rabies vaccine is current. If not, vaccinate. Month 5. Have rabies titer blood draw. Done at least 30 days after vaccination. Send to approved lab. Month 4. Receive titer results showing adequate antibodies. Begin 3-month waiting period. Month 2. Research airlines, book flights, arrange transport carrier. Month 1. Contact vet about health certificate, gather all documentation. Week 2. Tapeworm treatment if required. Week 1. Final vet exam, health certificate issued. USDA endorsement obtained. Day of travel. Fly to UK with all paperwork. Arrival. Pet cleared at customs. No quarantine if all requirements met. Released immediately. This assumes everything goes smoothly. Build buffer time. Delays happen. Moving internationally with cats is complicated, stressful, and expensive, but it's also doable with planning and attention to detail. Your cat can successfully relocate to virtually any country if you meet the requirements. Start early. Research thoroughly. Follow timelines. Use professional help if needed. And once you're settled in your new country, give your cat time to adjust. They'll forgive you for the stress of moving once they realize this new place is home. Your cat is family. Moving without them isn't an option for most people. So you do what's necessary to bring them along, navigating bureaucracy, managing logistics, and providing support through the transition. And when you're both settled in your new home, looking back on the complexity of what you accomplished, you'll realize it was absolutely worth it. Section 10. End-of-life care. Detailed. Let's talk about the hardest part of loving a cat, letting them go. This is the section I wish you never needed, but if you share your life with cats, you will eventually face end-of-life decisions. Your cat will age, they'll develop terminal illness, their quality of life will decline, and you'll be forced to make the most difficult decision of pet ownership: when to say goodbye. This section is going to be emotional. It might make you cry. It might bring up grief from cats you've lost before. That's okay. Take breaks if you need them, but stay with me because this information is critical. How you handle your cat's final days, weeks, or months affects both their experience and your own grief process. Done well, end-of-life care provides comfort, dignity, and peace. Done poorly, it prolongs suffering or ends in crisis and trauma. We're going to cover quality of life assessment and how to evaluate it honestly, hospice care at home for cats in their final phase, pain management when cure is no longer possible, recognizing when euthanasia is the kindest option, the euthanasia process itself in complete detail so you know exactly what to expect, saying goodbye and being present, aftercare options including cremation and burial, grief and how to cope with the loss, and special considerations for multi-cat households when one cat is dying. This is comprehensive, compassionate, and honest information. You deserve to know the truth about what end of life looks like so you can make informed, loving decisions for your cat. Let's start with quality of life assessment because this is the foundation of every end of life decision. Quality of life is subjective, personal, and sometimes maddeningly difficult to assess. We love our cats. We don't want to lose them. This creates bias. We rationalize. We focus on the good moments and minimize the bad. We tell ourselves, they still purr sometimes, or they ate a little today, while ignoring that they're hiding constantly, barely moving, and clearly suffering. Quality of life assessment tools help cut through that bias with objective criteria. The most widely used is the HHHHHMM scale, developed by Dr. Alice Villalobos. It stands for hurt, hunger, hydration, hygiene, happiness, mobility, and more good days than bad. Each criterion is scored from 0 to 10, with 10 being best. A total score above 35 suggests acceptable quality of life. Below that, especially below 25, indicates poor quality of life where euthanasia should be seriously considered. Let's break down each criterion. Hurt. Is your cat in pain? Can pain be managed adequately with medication? A cat with well-controlled pain might score 8 or 9. A cat in obvious, unmanageable pain scores 0 to 3. Look for signs: reluctance to move, hiding, not grooming, changes in breathing, vocalizing when touched, or aggressive behavior when normally gentle. Hunger. Is your cat eating? Are they interested in food? A cat eating normally scores 10. A cat eating some but less than normal might score 5 to 7. A cat refusing all food scores 0. Hand feeding or appetite stimulants might improve this temporarily, but if your cat is completely uninterested in even their favorite treats, it's a bad sign. Hydration. Is your cat drinking? Are they dehydrated? Can dehydration be managed with subcutaneous fluids? A well-hydrated cat scores 10. A cat needing daily fluids but maintaining hydration might score 6 to 8. A cat so dehydrated they're lethargic and unresponsive despite fluid scores low. Hygiene. Can your cat groom themselves? Are they lying in urine or feces? Do they smell bad? Cats are fastidious. When they stop grooming, it's significant. When they can't move away from their waste, quality of life is severely compromised. Happiness. Does your cat show interest in anything? Do they purr? Do they seek interaction? Do they respond to you? A happy cat who greets you, purrs when petted, and shows curiosity scores high. A cat who seems depressed, doesn't respond to stimuli, and shows no joy scores low. Mobility. Can your cat move to food, water, and litter box? Can they get comfortable? Are they spending all their time in one position because moving hurts? A mobile cat scores high. A cat who can't reach resources or who struggles to stand scores low. More good days than bad. This is the gut check criterion. Over the past week, have there been more days where your cat seemed comfortable and engaged than days where they seemed to suffer? Be honest. If most days are bad, this score's low. Total these scores, honestly. If you're getting scores in the 20s or low 30s, your cat's quality of life is poor. If you're consistently scoring below 25, euthanasia is likely the kindest option. Another assessment tool is simpler. Ask yourself, if my cat could talk, would they want to continue living like this? Strip away your feelings about not wanting to lose them. Focus on their experience. Are they comfortable? Do they have any quality of life? Or are they enduring each day in discomfort, fear, or pain? Signs that quality of life is poor include inability or unwillingness to eat despite trying everything, severe unmanageable pain despite maximum medication, inability to breathe comfortably, constant hiding or trying to escape, loss of awareness or responsiveness, inability to stand or move, incontinence where the cat lies in their own waste, and that look in their eyes where the spark is gone and they're just existing, not living. One or two of these doesn't automatically mean it's time, but multiple signs, especially worsening over days, indicate your cat is telling you they're ready to go. Hospice care at home is an option for cats in their final phase, when cure is no longer possible, but death isn't imminent. Hospice focuses on comfort, not cure. You're managing symptoms, controlling pain, and making your cat's remaining time as good as possible. Hospice care includes aggressive pain management using multiple medications if needed, appetite stimulants and hand feeding to encourage eating, subcutaneous fluids if dehydration is an issue, anti-nausea medications if your cat is nauseous, oxygen support. At home for cats with breathing difficulties, keeping the cat clean and comfortable, bathing if needed, providing soft bedding, spending time with them, offering comfort and companionship. Create a comfortable space, a quiet room where your cat can rest undisturbed. Soft bedding, heated if the cat enjoys warmth. Easy access to food, water, and a low-entry litter box. Keep the space clean and calm. Hospice care is labor-intensive. You might be giving medications multiple times daily, hand feeding, administering fluids, and cleaning your cat frequently. It's physically and emotionally exhausting. Set boundaries for yourself. Decide in advance what level of care you can sustain and what conditions would prompt euthanasia. Don't let hospice care turn into prolonging death rather than supporting life. If your cat's condition deteriorates to the point where they're suffering despite all interventions, it's time to let go. Pain management in end-stage disease focuses on comfort. You're not treating the underlying disease anymore. You're managing symptoms to keep the cat comfortable. Medications might include opioids like buprenorphine or fentanyl patches for severe pain, NSAIDs if appropriate and not contraindicated by kidney function, gabapentin for nerve pain, tramadol, though its effectiveness in cats is debated, steroids like prednisone, which reduce inflammation and improve appetite, providing comfort even if they don't extend life. Dosing might be higher and more frequent than typical because comfort is the goal, not longevity. Work with your vet to find the right combination. Non-pharmaceutical pain management includes keeping the cat warm with heated beds, avoiding unnecessary handling or movement, providing easy access to everything so they don't have to walk far, and offering emotional comfort through your calm presence. When to consider euthanasia is the question that haunts every cat owner facing this decision. You don't want to do it too early, robbing your cat of good time. But you desperately don't want to do it too late, allowing suffering. Finding that balance is agonizing. Here's the guidance. It's better to be a week early than a day late, meaning if you're unsure and debating whether it's time, it's probably close to time. Waiting for absolute certainty often means waiting until your cat is in crisis, suffering, or dying traumatically. Acting when your cat still has some quality but you can see it deteriorating rapidly prevents that crisis. Quality of life scales scoring consistently low. When multiple assessments over days or weeks show scores below 30 or especially below 25, it's time. Your cat stops responding to pain management. You've tried multiple medications, increased doses, and nothing provides adequate relief. They're still in pain. At that point, continuing is prolonging suffering. Your cat loses interest in everything. They don't eat, don't drink, don't respond to you, don't purr, don't show any sign of enjoying life. They're existing, not living. Your vet recommends euthanasia. Vets don't make this recommendation lightly. If your vet suggests it's time, take that seriously. You can't provide adequate care. If your cat needs more care than you can give, physically, financially, or emotionally, and they're suffering as a result, euthanasia might be kinder than inadequate management. The disease has progressed to the point where symptoms can't be controlled. Untreatable pain, inability to breathe, seizures that don't respond to medication, or other unmanageable symptoms. Your cat is actively dying. If your cat is in the dying process, gasping, unresponsive, in distress, euthanasia provides a peaceful end rather than a potentially prolonged, distressing death. The euthanasia process itself is something many people don't understand, and fear of the unknown makes it harder. Knowing exactly what happens helps you prepare and be present for your cat. Euthanasia is an overdose of anesthetic, typically pentobarbital. It's injected intravenously. It works within seconds to minutes. The cat loses consciousness immediately, then breathing and heartbeats stop. It's peaceful, painless, and fast. You can choose in-home euthanasia or clinic euthanasia. In-home is more expensive, but allows your cat to pass in familiar surroundings without the stress of a vet visit. Mobile vets who specialize in end-of-life care will come to your home. Clinic euthanasia is usually less expensive and readily available. Your regular vet can perform it. Before the procedure, you'll have time with your cat. Some people bring favorite foods and let their cat eat one last meal of whatever they want. Others sit quietly, petting and talking to their cat. There's no right way. Do what feels right for you and your cat. The vet will explain the process. They'll usually give a sedative first, injected under the skin or into muscle. This makes your cat sleepy and relaxed within 5 to 15 minutes. Once your cat is sedated, the vet will place an IV catheter in a vein, usually in the front leg. With the sedative on board, your cat likely won't react to the catheter placement. You can be present for the entire process or step out. Neither choice is wrong. Some people need to be there, holding their cat, until the end. Others find it too distressing and prefer to say goodbye before the final injection. The vet will support whatever you choose. When you're ready, the vet injects the euthanasia solution through the IV catheter. Your cat will become deeply unconscious within seconds. Breathing will slow and stop. The heart will stop shortly after. The entire process from injection to death takes typically 30 seconds to 2 minutes. Things that might happen that you should know about. Your cat's eyes will likely stay open. Cats don't close their eyes when they die. The vet might close them for you afterward. Your cat might take a few deep breaths or gasps as they pass. This is a reflex, not distress. They're already unconscious. Muscles might twitch or relax, causing limbs to move or the bladder or bowels to release. This is normal. Your cat might make sounds, sighs, or vocalizations as air leaves the lungs. Again, this is reflex, not pain or awareness. The vet will check for a heartbeat and confirm your cat has passed. They'll give you as much time as you need with your cat's body afterward. The emotional experience is intense. You might cry, you might feel numb, you might feel relief that their suffering is over, then feel guilty about the relief. All of these reactions are normal. Saying goodbye is deeply personal. Some people talk to their cat, thanking them for years of companionship, telling them they're loved, and giving them permission to go. Others sit in silence, holding their cat and crying. Some people aren't there at all, saying goodbye earlier. None of these is wrong. If you have children, deciding whether they should be present is difficult. This depends on the child's age, maturity, and relationship with the cat. For some children, being present provides closure and demonstrates that death can be peaceful. For others, it's traumatizing. Consider your child's personality and discuss it with them beforehand. Aftercare options need to be decided before or immediately after euthanasia. What happens to your cat's body? You have several choices. Home burial is legal in some areas, illegal in others. Check local regulations. If legal and you have appropriate space, burying your cat in your yard allows you to create a memorial spot. Bury at least 3 feet deep to prevent scavengers from disturbing the remains. Understand that if you move, you leave the grave behind. Private cremation means your cat is cremated individually and you receive only your cat's ashes back. These are typically returned in an urn or container. Costs range from $100 to $300 or more. Ashes can be kept in an urn, scattered in a meaningful location, or even incorporated into memorial jewelry or art. Communal cremation means your cat is cremated with other pets, and you don't receive ashes back. This is the least expensive option, typically $50 to $150. Some people choose aquamation, also called alkaline hydrolysis or water cremation, an environmentally gentler alternative to flame cremation. Not all areas offer this. Taxidermy is an option some people choose, though it's uncommon. Your cat's body is preserved and mounted. This isn't for everyone, but for some, it provides comfort. Leaving the body with the vet for standard disposal is also an option if you don't want cremation or burial. The vet will handle the body respectfully. Make these decisions beforehand if possible. Deciding while you're grieving immediately after euthanasia is harder. Grief after losing a cat is real, profound, and often underestimated by people who haven't experienced it. Society sometimes minimizes pet loss. "It's just a cat," or "you can get another one," are comments well-meaning people make that are incredibly hurtful. Ignore those people. Your grief is valid. You've lost a family member, a companion who was part of your daily life for years or even decades. You're allowed to grieve deeply. Grief stages aren't linear. You might experience denial, anger, bargaining, depression, and acceptance, but not in that order and not once each. You'll cycle through emotions. You'll have good days and then suddenly be overwhelmed with grief weeks later. Guilt is common. Did I wait too long? Did I give up too soon? Should I have tried one more treatment? These questions torture grieving pet owners. The truth is, you made the best decision you could with the information you had at the time. You loved your cat. You didn't want them to suffer. Forgive yourself. Physical grief symptoms are real. Trouble sleeping, loss of appetite, crying, exhaustion, difficulty concentrating. These are normal grief reactions. Be gentle with yourself. Ways to cope with grief. Allow yourself to feel it. Don't suppress emotions. Cry when you need to. Talk about your cat with understanding people. Share memories. Look at photos if it helps. If it hurts too much, put photos away temporarily. Create a memorial, plant a tree, make a photo album, write about your cat. Some people find this comforting. Join pet loss support groups online or in person. Talking with others who understand helps. Consider pet loss counseling if grief is overwhelming. Therapists who specialize in pet loss understand the depth of this grief. Take care of yourself physically. Eat, sleep, exercise, even when you don't feel like it. Grief is exhausting. When to get another cat is a common question. There's no right answer. Some people adopt within weeks, finding that caring for a new cat helps them heal. Others need months or years. Some never want another cat. All are valid. Don't let anyone pressure you. When you're ready, you'll know. Getting another cat isn't replacing the one you lost. Each cat is unique. A new cat is a new relationship, not an attempt to recreate what you had. Multi-cat household considerations when one cat is dying are complex. The other cats know something is wrong. They might react to the dying cat differently, spending more time with them, grooming them, or avoiding them. After the cat passes, surviving cats often search for them, vocalize, or seem depressed. They're grieving too. Should you let surviving cats see the body after death? Opinions vary. Some believe it provides closure, showing the cats that their companion has died and isn't coming back. Others feel it's unnecessary or even distressing. If you choose to let them see the body, do so briefly, allowing them to sniff and investigate, then remove the body. Surviving cats might need extra attention, play, and reassurance. They're adjusting to the loss just as you are. One more thing about end-of-life decisions. You know your cat. You've lived with them, cared for them, loved them. Trust yourself. If you feel in your heart that it's time, it probably is. If you feel they still have quality time left, that's valid too. No one else can make this decision for you. Not your vet, not your family, not strangers on the internet. It's your responsibility and your burden to bear. When you make the decision, make it out of love, not fear or guilt. Choose what's best for your cat, even when it breaks your heart. End-of-life care and euthanasia are the final gifts you give your cat. The gift of a peaceful death, free from prolonged suffering. The gift of dignity. The gift of your presence and love in their final moments. It hurts. It will always hurt. But you're doing the right thing. You're putting their needs above your desire to keep them with you. That's love in its purest form. Your cat has been lucky to have you. And when the time comes, whenever that is, you'll find the strength to let them go because you love them. And sometimes, love means goodbye. Section 11. Cat-proofing for specific dangers. Let's talk about something that often gets overlooked until tragedy strikes. The specific hidden dangers that exist in our homes and can seriously harm or kill cats. Most people know the basics. Don't leave chocolate lying around. Keep windows closed or screened. But there are dozens of dangers that aren't obvious, that seem harmless, or that you'd never think could hurt a cat until it happens. I'm not here to make you paranoid. Your home doesn't need to be a padded, sterile bubble. But awareness of specific dangers allows you to cat-proof strategically, addressing real risks without going overboard. We're going to cover toxic plants and which ones are genuinely dangerous versus just mildly irritating. Household chemicals and the surprising things that are toxic, string and linear foreign bodies, which cause more emergency surgeries than you'd think, window and balcony safety because high-rise syndrome is real, small objects that cats swallow, heat sources and burn risks, electrical hazards and holiday-specific dangers that spike emergency vet visits every year. Let's start with plants because this is an area where misinformation is rampant. You'll find lists online claiming hundreds of plants are toxic to cats. Some of those lists include plants that cause mild stomach upset if eaten in large quantities. Others list genuinely deadly plants. The problem is they're all lumped together, creating either panic or complacency. Here's the truth. Some plants are severely toxic. Even small amounts can cause kidney failure, heart problems, or death. Other plants are mildly toxic, causing vomiting or diarrhea but not life-threatening issues. Some plants are safe. The most dangerous plants, the ones you absolutely cannot have in a home with cats, include lilies. True lilies, members of the Lilium and Hemerocallis genera, are devastatingly toxic to cats. Easter lilies, tiger lilies, Asiatic lilies, daylilies, and stargazer lilies all fall into this category. Even tiny exposures cause acute kidney failure. A cat who licks pollen off their fur, drinks water from a vase containing lilies, or chews on a single leaf can develop fatal kidney failure within days. There is no antidote. Treatment is aggressive supportive care with intravenous fluids, but even with treatment, many cats die or are left with permanent kidney damage. If your cat is exposed to lilies, it's an immediate emergency. Get to a vet within hours, not days. The sooner treatment starts, the better the prognosis, but it's still guarded. Remove all lilies from your home. Tell family and friends not to bring lilies as gifts. If someone sends you flowers, check before bringing them inside. It's not worth the risk. Autumn crocus, also called meadow saffron, contains colchicine, which causes severe gastrointestinal distress, liver and kidney damage, and bone marrow suppression. Ingestion can be fatal. Sago palm, a common ornamental plant, contains psychocin, which causes liver failure. All parts of the plant are toxic, but the seeds are most concentrated. Ingestion often results in death even with aggressive treatment. Oleander contains cardiac glycosides that affect heart function. Even small amounts can cause serious heart arrhythmias and death. Azaleas and rhododendrons contain granotoxins that affect the cardiovascular and nervous systems, causing vomiting, diarrhea, drooling, weakness, and potentially coma or death. Tulips and hyacinths contain toxins concentrated in the bulbs. Cats who dig up and chew bulbs can experience gastrointestinal upset and, in severe cases, heart problems. Cyclamen contains saponins that cause gastrointestinal upset. The tubers are most toxic and can cause seizures and death if eaten in sufficient quantity. Kalanchoe contains cardiac glycosides affecting heart rhythm. All parts are toxic. Dieffenbachia and philodendron contain calcium oxalate crystals that cause intense oral pain, drooling, and difficulty swallowing. They're not typically fatal, but extremely painful. If your cat ingests any of these plants, contact your vet or animal poison control immediately. Bring a sample of the plant if possible for identification. Mildly toxic plants cause upset stomach, but aren't typically life-threatening. These include aloe vera, spider plants, pothos, rubber plants, and many others. If your cat chews these, they might vomit or have diarrhea, but they'll likely recover without treatment. Still, it's better to keep plants out of reach. Safe plants for homes with cats include catgrass, spider plants if your cat doesn't overindulge, Boston ferns, and African violets. If you want greenery in your home, stick to confirmed safe plants or use artificial plants. Household chemicals are another major danger. Cats walk across surfaces, then groom their paws, ingesting whatever was on those surfaces. They're also curious and might lick or chew things that smell interesting. Toxic household chemicals include antifreeze, which tastes sweet and is incredibly appealing to cats. Ethylene glycol causes acute kidney failure. Even tiny amounts are fatal. Clean up spills immediately. Store containers securely. Consider using propylene glycol-based antifreeze, which is less toxic, though still not safe to ingest. Rat and mouse poison comes in several types, all dangerous. Anticoagulant rodenticides cause internal bleeding. Cholecalciferol rodenticides cause kidney failure. Bromethalin causes neurological damage. If your cat ingests rodenticide, it's an emergency requiring immediate treatment. Household cleaners, especially those containing bleach, ammonia, phenols, or pine oils, can be toxic if ingested or if cats walk through them and then groom their paws. Use pet-safe cleaners or ensure cats don't have access to areas being cleaned until surfaces are dry. Essential oils are concentrated plant compounds. Many are toxic to cats. Tea tree oil, pennyroyal, wintergreen, pine, cinnamon, citrus oils, and others can cause liver damage, neurological issues, or respiratory distress. Cats lack certain liver enzymes to metabolize these compounds. Don't use essential oil diffusers in homes with cats. Don't apply essential oils to your cat, and be cautious about topical products containing them. Medications, both human and veterinary, are dangerous if cats ingest them. Acetaminophen, the active ingredient in Tylenol, is extremely toxic to cats. A single regular-strength tablet can be fatal. Ibuprofen and aspirin cause gastrointestinal ulcers and kidney failure. Antidepressants, ADHD medications, and many other human drugs are toxic. Store all medications securely. Never give human medications to cats unless specifically prescribed by your vet. Permethrin, found in some dog flea treatments, is highly toxic to cats. Never use dog flea products on cats. Even exposure to a recently treated dog can cause toxicity. Signs include tremors, seizures, and hyperthermia. This is an emergency. String, thread, ribbon, yarn, tinsel, and dental floss are linear foreign bodies, one of the most common causes of emergency surgery in cats. Cats have backward-facing barbs on their tongues. When they start chewing string, they can't spit it out. They swallow it. String alone might pass through the digestive tract uneventfully, but often one end gets anchored under the tongue, in the stomach, or at a turn in the intestines, while the rest of the string continues moving. The intestines bunch up on the string like a drawstring bag cinching closed. This is called a linear foreign body obstruction. It's life-threatening. The string can saw through the intestinal wall, causing perforation, sepsis, and death. Emergency surgery is required to remove the string and repair damaged intestines. Even with surgery, prognosis can be guarded if perforation has occurred. Prevent this by not leaving string, ribbon, yarn, or thread accessible. Put away sewing supplies. Don't leave hair ties lying around. After holidays, immediately dispose of ribbon and tinsel. Some cats are obsessed with eating these things. If your cat is one of them, be extra vigilant. If you see string hanging from your cat's mouth or anus, do not pull it. This can worsen damage. Get to a vet immediately. Window and balcony safety is critical for cats, especially in high-rise buildings. High-rise syndrome is the term for injuries cats sustain falling from windows or balconies. You'd think cats always land on their feet and survive falls. Sometimes they do, often they don't. Falls from 2nd to 7th floors are often fatal or cause severe injuries: broken jaws, shattered legs, ruptured lungs, internal bleeding. Interestingly, falls from higher floors sometimes have better survival rates because cats reach terminal velocity, relax, and spread their bodies, distributing impact. But don't count on this. Cats die from high falls regularly. Screen all windows, not just windows you think your cat can reach. Cats are amazing climbers and jumpers. Use sturdy screens, not flimsy ones that rip easily. Secure screens so cats can't push them out. Some cats launch themselves at screens chasing bugs or birds, and weak screens give way. Enclose balconies if your cat has access. Netting or screening prevents falls. Balconies seem safe because there are railings, but cats jump onto railings, lose balance, or misjudge jumps. Never assume your cat won't jump. Even cautious cats sometimes make impulsive decisions when they see prey or are startled. Small objects cats swallow are another common emergency. Hair ties, rubber bands, small toys, plastic bits, foam earplugs, strings from blinds, twist ties, and countless other items are tempting to cats. Some pass through the digestive tract. Others get stuck, causing obstruction, perforation, or require surgery. Signs of foreign body obstruction include vomiting, loss of appetite, lethargy, and abdominal pain. Sometimes these signs develop immediately. Other times, they're delayed by days. If you see your cat swallow something they shouldn't, contact your vet. Depending on what it was and how recently, inducing vomiting might be an option. X-rays can sometimes reveal foreign objects. Surgery might be necessary. Prevention involves keeping small objects out of reach. Scan your floors regularly. Be mindful of what you leave on counters. If your cat is a known eater of weird things, consider limiting their access to rooms where temptations exist. Heat sources and burn risks include stove burners, space heaters, candles, and heating pads. Cats seek warmth and can get too close to heat sources, burning themselves. Stove burners are particularly dangerous. Cats jump onto stoves to access counters or investigate smells. If a burner is hot or has just been turned off, cats can burn their paws. Use stove guards or deterrents. Don't leave burners unattended. Consider an electric kettle instead of boiling water on the stove where a cat could knock it over. Space heaters should have protective guards and automatic shutoff features. Don't leave them running unattended with cats nearby. Candles are fire hazards. Cats knock them over or brush against flames with their tails. Use flameless LED candles for ambiance. Heating pads designed for humans can cause burns if cats lie on them too long. Use pet-specific heating pads with thermostats that maintain safe temperatures. Electrical cords are chewing hazards. Some cats, especially young ones, chew cords. This can cause electrical burns to the mouth, tongue, and lips. Severe cases cause shock, lung damage from fluid accumulation, or death. Protect cords with cord covers, bitter spray deterrents, or by concealing them. Unplug appliances when not in use. Watch for signs of cord chewing, singed whiskers, burns around the mouth, or difficulty breathing after being near cords unsupervised. Holiday dangers spike vet visits predictably every year. During Christmas, Easter, Halloween, and other holidays, specific hazards emerge. Christmas dangers include tinsel, which causes linear foreign body obstructions. Tinsel is particularly dangerous because it's shiny and fascinating to cats. Don't use it. Glass ornaments that shatter create sharp edges. Cats bat ornaments off trees and can cut themselves. Use shatterproof ornaments. Ornament hooks are sharp and can pierce mouths or paws. Use twist ties or ribbon instead. Christmas tree water often contains preservatives or additives toxic to cats. Cover the reservoir or use plain water. Electrical cords from lights invite chewing. Secure and monitor. Certain plants like poinsettias, holly, and mistletoe are toxic. Poinsettias cause mild stomach upset. Holly and mistletoe are more dangerous. Easter dangers include lilies, as discussed. Easter is peak lily season. Also chocolate, especially around Easter egg hunts where chocolate is hidden and might not be found before curious cats are. Plastic grass in Easter baskets is a linear, foreign body hazard similar to tinsel. Halloween dangers include candy, especially chocolate and xylitol-containing candies. Xylitol causes liver failure in cats. Costumes with small parts can be chewed or swallowed. Lit candles inside jack-o'-lanterns are fire and burn hazards. Thanksgiving dangers include rich, fatty foods given as treats that cause pancreatitis, turkey bones that splinter and cause perforations, onions, garlic, and chives used in cooking, all toxic to cats. Grapes and raisins, though toxicity is less documented in cats than dogs, still best avoided. Every holiday, vet clinics see preventable emergencies. Keep cats away from holiday decorations, foods, and festivities. Confine them to a safe room if you're hosting gatherings where doors open frequently or where guests might not be cat-aware. The overarching principle of cat-proofing is awareness followed by action. You can't protect against dangers you don't know exist. Now you know. Walk through your home with fresh eyes. Look for potential toxins, swallowable objects, string-like items, heat sources too accessible, windows without secure screens, and holiday decorations that pose risks. You don't need to eliminate every potential danger. Some risk is unavoidable in normal life, but you can significantly reduce risk by addressing the most common and most dangerous hazards. If your cat ingests something toxic or you suspect they have, contact your vet or ASPCA animal. Poison control immediately. Time matters. Early intervention often makes the difference between life and death. Have the number for poison control saved, 888-426-4435. There's a consultation fee, but it's worth it for expert guidance. Cat-proofing is an ongoing process. As you bring new things into your home, consider cat safety. As your cat ages and their behaviors change, reassess. Stay informed about new products or substances identified as toxic. Your cat depends on you to create a safe environment. They don't understand dangers. They explore, chew, jump, and climb because that's what cats do. It's our responsibility to make their environment as safe as possible while still allowing them to be cats. With awareness, vigilance, and proactive cat proofing, you can dramatically reduce the risk of preventable tragedies. Section 12. Grooming Advanced Techniques. Let's talk about grooming beyond the basics. Most cat owners know they should brush their cat occasionally, maybe trim nails when they get too long, but grooming is more complex than that, especially for certain cats. Long-haired breeds, senior cats who can't groom themselves effectively, cats with medical conditions, or cats who are aggressive during grooming all present challenges that require advanced techniques. Proper grooming isn't just about aesthetics, it's about health. Matted fur causes pain and skin infections. Overgrown nails curl into paw pads. Dirty ears develop infections. Dental disease shortens lifespan. Neglected grooming leads to suffering and expensive veterinary treatment. We're going to cover comprehensive grooming techniques that go beyond what most owners know. Long-haired cat care and preventing or removing mats, bathing cats when necessary, and how to do it without trauma, at-home dental care to supplement professional cleanings, proper nail trimming technique, including handling bleeding, ear cleaning when it's needed, and when to leave ears alone, eye care and discharge removal, anal gland expression, and recognizing when it's needed, grooming senior cats who struggle with self-maintenance, handling aggressive or fearful cats during grooming, knowing when to seek professional grooming help, and the tools and products worth investing in. Let's start with long-haired cats because they require the most intensive grooming. Persians, Maine Coons, Ragdolls, Himalayans, and other long-haired breeds don't maintain their coats through self-grooming alone. Without regular brushing, they're fur mats. Mats are clumps of tangled fur that pull tight against the skin. They're painful. They restrict movement. Severe matting can cause skin infections, restrict blood flow, and create areas where parasites hide. Preventing mats is easier than removing them. Brush long-haired cats daily, or at minimum every other day. Use the right tools. A slicker brush with fine wire bristles works well for removing loose fur and preventing tangles. A metal comb, specifically a greyhound comb with both wide and narrow teeth, helps find mats early before they tighten. Brush in layers. Don't just skim the surface. Part the fur and brush down to the skin. Pay special attention to friction areas where mats form most: behind the ears, under the front legs and the armpits, the belly, the back legs where they meet the body, and around the tail base. If you find small mats starting to form, address them immediately. Hold the fur between the mat and the skin so you don't pull the skin. Gently work through the mat with your fingers, a comb, or a mat splitter tool. If the mat is tight and won't come apart, carefully cut it out with scissors or clippers. Be extremely careful not to cut skin. Cat skin is thin and loose. It's easy to accidentally cut them. If you're not confident, have a groomer or vet remove mats. Large, severe mats can't be safely removed at home. They require professional grooming or veterinary sedation. Trying to remove severe mats yourself risks cutting your cat or causing such pain they bite or scratch in defense. Some cats develop mats so extensively they need a full shave under sedation. This is called a lion cut or lion shave, where the body fur is clipped short, leaving a mane around the head and a tuft on the tail. It looks silly, but it's sometimes medically necessary. After shaving or mat removal, commit to regular brushing to prevent recurrence. If you can't maintain a long-haired cat's coat, consider whether that breed is appropriate for your lifestyle. Bathing cats is controversial. Some people say, never bathe cats. Others bathe regularly. The truth is somewhere in the middle. Most cats don't need regular baths. They groom themselves effectively. Overbathing strips natural oils, causes dry skin, and stresses cats unnecessarily. However, some situations require baths. Cats who get into something toxic need immediate bathing to prevent ingestion during grooming. Cats with diarrhea who have feces matted in their fur need cleaning. Long-haired cats sometimes develop urine or feces staining that won't come out with brushing. Senior or arthritic cats who can't groom properly might develop greasy, dirty fur. Hairless breeds like Sphinx cats need regular bathing because they produce skin oils without fur to absorb them. If you must bathe your cat, here's how to minimize trauma. Use a cat-specific shampoo. Human shampoo has the wrong pH and can irritate cat skin. Choose a mild, fragrance-free formula. Prepare everything beforehand. Warm, not hot, water. Shampoo within reach. Towels ready. Don't leave a wet cat to go find supplies. Trim your cat's nails beforehand if possible, to reduce injury if they panic. Use a sink or tub. Fill with 2 to 3 inches of warm water before bringing your cat in. Running water while they're present is frightening. Place a rubber mat or towel in the bottom so they have traction. Slipping increases panic. Gently lower your cat into the water. Hold them firmly but not tightly. Talk in a calm, soothing voice even if you're stressed. Wet their fur thoroughly. Use a cup or handheld sprayer on low pressure. Avoid getting water in ears, eyes, and nose. Apply a small amount of shampoo. Lather gently, working it into the fur. Focus on dirty areas. Rinse thoroughly. Leftover shampoo causes skin irritation. Rinse until water runs clear. Lift your cat out and wrap immediately in a towel. Pat dry, don't rub vigorously. Some cats tolerate blow dryers on low, cool settings. Most hate them. Let them air dry in a warm room if they won't tolerate drying. Expect your cat to groom obsessively after bathing. This is normal. They're restoring their scent. Some cats become aggressive or panicked during baths. For these cats, waterless shampoos or grooming wipes are alternatives. These products clean without immersion. They're not as effective as bathing, but better than nothing. If your cat absolutely cannot tolerate bathing and needs it for medical reasons, professional groomers or vets can sedate them for grooming. At-home dental care supplements, professional cleanings, but doesn't replace them. We discussed dental disease in Part 1. Here we're focusing on home maintenance. Brushing your cat's teeth is the gold standard. Daily brushing prevents plaque buildup. Use a cat-specific toothbrush, either a finger brush that fits over your fingertip or a small, soft bristled brush. Use enzymatic cat toothpaste. Never use human toothpaste. It contains ingredients like xylitol that are toxic to cats, and the foaming agents upset their stomachs. Introduce toothbrushing gradually. Don't go from never touching their mouth to scrubbing vigorously. Start by letting them lick toothpaste off your finger. They often like the flavor, which is formulated to appeal to cats, often chicken or fish flavored. Progress to rubbing your finger along their gums and teeth. Just get them used to the sensation. After several days, introduce the toothbrush. Let them lick paste off it. Then gently brush a few front teeth. Over weeks, work up to brushing all teeth. Focus on the outside surfaces, the side toward the cheek. That's where plaque accumulates most. You don't need to brush inside surfaces thoroughly. Most cats won't tolerate it anyway. Even imperfect brushing helps. If you only manage a few teeth, it's better than nothing. Aim for daily, but even a few times a week provides benefit. Dental treats and chews marketed for cats have limited effectiveness. Some studies show slight reduction in tartar with specific products, but they're not substitutes for brushing or professional cleanings. If your cat enjoys them and they don't cause weight gain, they're fine to offer, but don't rely on them. Water additives claim to reduce plaque. Evidence is mixed. Some contain chlorhexidine or other antimicrobials that may help. Others are essentially useless. The Veterinary Oral Health Council, VOHC, certifies products that meet effectiveness standards. Look for their seal of approval. Proper nail trimming prevents overgrown nails that curl into paw pads, get caught on things, or cause difficulty walking. Trim nails every 2 to 4 weeks depending on growth rate. Use cat-specific nail clippers. Guillotine style or scissor style both work. Choose what feels comfortable in your hand. Examine the nail before cutting. Cat nails are translucent in light-colored nails, allowing you to see the quick, the pink area containing blood vessels and nerves. You want to cut below the quick, removing only the sharp, clear tip. Dark nails make this harder. You can't see the quick. Cut conservatively, just the very tip. Better to trim less frequently than cut too much and hit the quick. Hold your cat's paw gently. Press the pad to extend the nail. Position clippers perpendicular to the nail and cut cleanly. Don't saw or squeeze, which can splinter the nail. If you accidentally cut the quick, your cat will vocalize and bleed. Don't panic. Apply styptic powder, cornstarch, or flour to the nail tip. Press gently for several seconds. The bleeding will stop. Your cat will be fine, just unhappy with you for a bit. Trim only the front paws for most cats. Front claws cause the most damage. Back claws are less problematic and less overgrown. Some cats tolerate all 4 paws being trimmed. Others fight past the front too. If your cat is impossible to restrain for nail trims, ask your vet to do it during routine visits. Have a groomer do it or consider training with positive reinforcement over weeks. Ear cleaning is necessary for some cats, unnecessary and harmful for others. Healthy ears are self-cleaning. They don't need routine cleaning. Clean ears only if they're dirty or your vet recommends it for specific conditions like ear mites or infections. Dirty ears have visible debris, dark brown waxy buildup, or bad odor. Clean ears are pale pink with minimal to no visible wax. To clean, use a cat-specific ear cleaning solution. Don't use water, alcohol, or hydrogen peroxide. These irritate or don't effectively remove debris. Fill the ear canal with solution. Massage the base of the ear for 30 seconds. You'll hear a squishing sound. This loosens debris. Let your cat shake their head. They'll fling solution and debris out. Wipe the outer ear with a cotton ball or soft cloth. Never insert cotton swabs into the ear canal. You'll push debris deeper or damage the eardrum. If your cat's ears are frequently dirty, that's abnormal. See your vet. Chronic dirty ears suggest mites, allergies, or infections needing treatment. Eye care involves removing discharge when necessary. Some cats, particularly flat-faced breeds like Persians, have tear overflow causing crusty buildup in the corners of their eyes. Wipe discharge with a soft, damp cloth or cotton ball. Use warm water. Wipe gently from the inner corner outward. Use a fresh area of the cloth for each eye to avoid spreading bacteria. If discharge is excessive, green, yellow, or accompanied by squinting, redness, or cloudiness, that's not normal. See your vet. It could indicate infection or injury. Anal gland expression is something many cat owners have never heard of. Cats have two small glands just inside the anus that produce foul-smelling fluid. Normally, these glands express naturally during defecation. Sometimes they become impacted, not emptying properly. Signs of impacted anal glands include scooting the rear on the floor, excessive licking of the rear, foul odor, swelling beside the anus, or difficulty defecating. Most cats never need manual expression. Some cats, particularly obese cats or those with chronic diarrhea, develop problems requiring periodic expression. Vets or groomers typically perform this. It's not pleasant. The fluid smells horrific. The technique involves inserting a gloved finger into the rectum and squeezing the glands to express fluid. It's uncomfortable for the cat. You can learn to express anal glands externally, squeezing from outside, but it's less effective. If you want to learn, have your vet demonstrate proper technique. If your cat's anal glands become chronically impacted despite expression, surgical removal is an option. Recovery is painful, but it permanently resolves the problem. Senior cat grooming presents unique challenges. Older cats develop arthritis that limits their flexibility. They can't reach parts of their body for grooming. Fur becomes greasy, matted, or develops clumps. Increased grooming frequency helps. Brush your senior cat daily. Focus on areas they can't reach: the back, the rear end, and the tail base. Some seniors develop chronic conditions causing them to soil themselves. Diarrhea, urinary incontinence, or simply inability to position properly in the litter box leads to urine or feces, stained fur. Clean these areas promptly. Use pet-safe wipes or damp cloths. If staining is severe, spot bathe just the affected area without immersing the whole cat. Nail trimming is critical for seniors. Overgrown nails in arthritic cats cause significant pain. Trim more conservatively if your senior is less tolerant of restraint. Dental disease progresses in senior cats. Prioritize dental cleanings and home care to prevent painful conditions that cause eating difficulties. Handling aggressive or fearful cats during grooming requires strategy. Some cats tolerate grooming if done correctly, but react aggressively if scared or hurt. Go slowly. Don't restrain forcefully. This escalates aggression. Instead, work in short sessions. Brush for 1 minute, then release. Repeat later. Gradually increase duration. Desensitization helps. Pair grooming tools with treats. Let your cat sniff the brush. Give a treat. Touch the brush to their fur briefly. Treat. Build positive associations over weeks. For extremely aggressive cats, consider chemical restraint. Your vet can prescribe mild sedatives like gabapentin to give before grooming. This reduces anxiety without full sedation, making grooming safer. Professional groomers experienced with difficult cats use humane restraint techniques, patience, and sometimes even light sedation with vet approval. If grooming causes such severe stress or aggression that it's dangerous or traumatic, have your vet perform grooming under sedation when necessary, such as for mat removal or nail trims. When to seek professional grooming help includes severe matting you can't safely remove, cats who are impossible to handle at home, breed-specific grooming like showcat grooming or lion cuts, and situations where you lack confidence or tools. Professional groomers have experience, proper tools, and restraint skills. Costs vary, typically $50 to $100 or more depending on services and location. Mobile groomers come to your home, reducing travel stress. This is ideal for anxious cats. Tools and products worth investing in include a high-quality slicker brush for daily brushing, a metal comb for finding mats and thorough combing, nail clippers specifically designed for cats, styptic powder in case you hit the quick, cat-specific toothbrush and enzymatic toothpaste, ear cleaning solution, and grooming wipes for spot cleaning. Avoid tools marketed as de-shedding tools like the Furminator for long-haired cats. These can damage the coat if used improperly. They're acceptable for short-haired cats with supervision. Invest in good tools once, rather than replacing cheap ones repeatedly. Grooming is an overlooked aspect of cat care. Done well, it maintains health, prevents painful conditions, strengthens your bond, and allows you to notice problems early by handling your cat regularly. Done poorly or not at all, it leads to matted fur, overgrown nails, dental disease, and suffering. The techniques in this section go beyond basics. Applying them makes you a more competent, confident cat owner, capable of handling your cat's grooming needs throughout their life, from kittenhood through their senior years. Your cat will be healthier, more comfortable, and better cared for as a result. Section 13. Cat shows and competitions. Let's talk about something most cat owners never experience but might be curious about: cat shows and competitions. Maybe you've seen photos of cats in cages being judged, or you've heard about champion bloodlines, or you've wondered what those letters after a cat's name mean. Maybe you think your cat is the most beautiful creature ever created, and you're curious if others would agree. Or maybe you're just interested in understanding this whole world. Cat shows exist on a spectrum from casual fun events to serious high-stakes competitions where breeding reputations and significant money are involved. Most people will never show their cats and have no reason to. But understanding the show world helps you appreciate cat breeds, recognize quality breeders versus backyard breeders, and maybe satisfy curiosity about what those fancy cats at shows are actually being judged on. We're going to cover what cat shows are and how they function, the major cat show organizations and their differences, breed standards and what judges evaluate, household pet categories for non-purebred cats, preparing a cat for showing, what happens on show day, costs and time commitment, breeding and showing connections, titles and what they mean, and whether showing might be something you'd want to explore. Cat shows, also called cat fancier shows, are competitive events where cats are judged against breed standards or in household pet categories. Think dog shows, but for cats. Judges evaluate cats based on how closely they conform to the ideal standard for their breed. The cat that best represents the breed standard wins. Shows are organized by cat registries, organizations that maintain pedigree records, and host shows. The major ones in North America are the Cat Fanciers Association, or CFA, the largest registry in the world. The International Cat Association, or TKA, the second largest, known for recognizing newer breeds. The American Cat Fanciers Association, or ACFA. The Cat Fanciers Federation, or CFF. Others exist regionally or internationally. Each organization has slightly different rules, recognized breeds, and show formats. CFA is considered the most traditional and prestigious, but also most conservative about accepting new breeds. TK is more progressive, recognizing breeds like Bengals and Savannahs that CFA took longer to accept. Cat shows typically last 1 or 2 days. Single-day shows are common. Larger shows run over weekends. The venue is usually a convention center, hotel ballroom, or similar space. Rows of cages house cats between judgings. Multiple judging rings operate simultaneously. Each ring has a judge, a table, and hanging cages where cats are placed for evaluation. Show formats vary. All breed shows include multiple breeds competing. Specialty shows focus on specific breeds or categories. Championship shows are for adult, intact cats of recognized breeds. Premiership shows are for spayed or neutered purebreds. Kitten shows are for cats under 8 months. Household pet shows are for non-purebred cats. Cats accumulate points toward titles by placing in shows. The number of points depends on how many cats they defeated. Defeating 100 cats earns more points than defeating 10. Titles progress from champion to grand champion to regional winner to national winner, with variations by organization. Breed standards are detailed descriptions of the ideal specimen of each breed. They cover body type, head shape, ear size and placement, eye color and shape, coat length and texture, color and pattern, tail length and shape, overall balance and proportion, and temperament. Judges memorize these standards. They handle each cat, feeling bone structure, checking teeth, evaluating coat texture, and observing movement and temperament. Judging is subjective within the standards framework. Two judges might rank the same cats differently based on personal interpretation of which flaws are more or less important. For example, Persian breed standards specify a round, massive head with full cheeks, a short, snub nose with break between eyes, large, round eyes set wide apart, small ears set far apart and low on the head, a cobby low on the legs body, and a long, thick coat. A Persian with a slightly longer nose than ideal might place lower than one with perfect nose, but slightly smaller eyes. The judge determines which conformation is closer to ideal. Maine Coon standards describe a large, muscular, rectangular body, a medium-length head with a squared muzzle, large, tufted ears set high on the head, large, expressive eyes, a long, shaggy coat, and a long, plumed tail. Each breed has unique requirements. Siamese should have wedge-shaped heads and vivid blue, almond-shaped eyes. British Shorthairs need round faces and copper eyes. Sphynx must have hairlessness with wrinkled skin. Coloration matters for some breeds. Certain patterns or colors are preferred or disqualified. Color point patterns must have proper contrast. Tabby markings must be distinct. White cats must have pure white coats without yellowing. Disqualifications remove cats from competition. These include health issues, obvious illness, pregnancy in championship shows, incorrect eye color for the breed, wrong number of toes, kinked tails in breeds where that's a fault, and aggression that prevents safe handling. Household pet categories allow non-purebred cats to compete. These cats are judged on health, condition, grooming, and temperament, not breed standards. The prettiest, best-groomed, friendliest cat wins. This category makes shows accessible to people with mixed-breed cats. Household pet showing is less intense than breed showing. Cats must be spayed or neutered to compete. It's often a fun introduction to shows without breeding or pedigree concerns. Preparing a cat for showing starts months before the first show if you're serious. Grooming is critical. Show cats have immaculate coats, trimmed nails, clean ears, and bright eyes. Long-haired breeds require daily brushing to prevent mats and achieve show-quality coats. Bathing 1 to 3 days before the show removes oils and fluffs the coat. Conditioning involves maintaining ideal weight and muscle tone. Overweight cats don't compete well, neither do underweight cats. Feed high-quality food to promote coat condition. Socialization ensures cats tolerate handling by strangers. Judges handle cats thoroughly. Cats who panic, scratch, or bite are excused from judging. Expose your cat to different people, handling, and environments from kittenhood. Training your cat to be calm in cages is important. Practice crating your cat at home. Take them on car rides. Simulate show conditions as much as possible. Health requirements include current vaccinations, often documented by a health certificate from your vet. Some shows require proof of vaccination within a specific time frame. Cats showing symptoms of illness are turned away. Show day starts early. Check-in is typically between 7 and 9 a.m. You're assigned a cage space. Setup involves covering the cage with curtains, providing litter box and water, and staging your cat's area. Many exhibitors decorate elaborately with themed curtains and accessories. Benching cages are where your cat stays between judgings. When your cat's class is called, you carry them to the judging ring and place them in a hanging cage. The judge removes each cat individually, examines them on the table, and returns them to the cage. After all cats in the class are judged, the judge announces placements and hangs ribbons. Judging happens multiple times throughout the day in different rings. Your cat might be judged 6 to 8 times by different judges. Each judging session lasts 5 to 15 minutes per class. Finals occur at the end of each ring's judging. Top cats from various classes compete for Best Cat, Best Kitten, Best Alter, and other awards. Finals are exciting, with judges announcing winners and praising each cat's qualities. Between judgings, you wait. Shows involve a lot of downtime. Bring things to do. Many exhibitors socialize, comparing cats, discussing breeding programs, and networking. Showing is exhausting for cats. Long days, strange sounds, unfamiliar cats nearby, and repeated handling stress even well-socialized cats. Watch for signs of stress and prioritize your cat's welfare over ribbons. Costs of showing add up quickly. Entry fees range from $50 to $150 per show, depending on the organization and number of entries. Travel expenses include gas or flights, hotels if the show is distant, and meals. Grooming supplies, show-quality cages, curtains, and accessories cost hundreds initially, though they're reusable. Health certificates from your vet before shows cost $50 to $100. If you're traveling frequently, expenses escalate quickly. Serious exhibitors spend thousands annually showing cats. Regional and national campaigns to achieve top titles can cost tens of thousands when you factor in travel to distant shows and advertising in cat fancy publications. Time commitment is significant. A local show consumes an entire weekend day, from early morning setup to late afternoon teardown. Traveling to shows adds drive time or flights. Preparation grooming takes hours before each show. To achieve high titles, you must attend many shows. A cat might need to compete in 20 to 50 shows over a year or more to earn grand champion status, depending on competition and points needed. Breeding and showing are interconnected. Serious breeders show cats to prove their quality. Titles validate breeding stock. A cat titled Grand Champion commands higher breeding fees, and their kittens sell for more. Show wins also help market a cattery. However, you don't need to breed to show. Many people show cats in premiership or household pet categories with no breeding intentions. They enjoy competition and socialization. If you do breed, showing provides valuable feedback. Judges tell you your cat's strengths and weaknesses. This guides breeding decisions. If multiple judges note your cat's ears are too large, you breed to cats with smaller ears to correct that fault. Titles and what they mean vary by organization, but generally progress like this. Registered cats with pedigrees start competing. After defeating a certain number of cats and accumulating points, they earn champion status. Continuing to show and win earns grand champion. Competing at regional levels can earn regional winner. Competing nationally can earn national winner, the highest title, typically awarded to top cats each season. Each title has specific point requirements. CFA requires 6 winner ribbons under 4 different judges for champion. Grand Champion requires points based on the number of cats defeated. The system is complex and varies. Letters before or after a cat's name indicate titles. CH means champion, GC or GRC means grand champion, RW means regional winner, NW means national winner. These titles stay with the cat permanently and appear on pedigrees. Whether showing is right for you and your cat depends on several factors. Do you have a purebred cat with breeding rights or a household pet you think is special? Are you willing to invest time and money with no guarantee of success? Does your cat have the temperament to tolerate shows? Can you handle the competition? Shows can be cliquish. Politics exist. Judges sometimes favor cats from well-known catteries. It's not always objective. Are you doing this for fun or serious competition? Household pet showing is lower stakes and can be enjoyable. Breed showing aiming for high titles is intense. If you're curious, attend a show as a spectator first. Watch judging, talk to exhibitors, and get a feel for the environment. Many shows welcome visitors. Entry is usually free or low cost. Try entering your cat once in household pet if they qualify. See how you and your cat handle it. You might love it or decide it's not for you. Either is fine. The show cat lifestyle isn't for everyone. It's expensive, time-consuming, and emotionally demanding. Losing hurts even when you know it's subjective. But for people who love it, showing provides community, validation of breeding programs, and deep satisfaction when their cat succeeds. You meet people who share your passion for cats. You learn about breeds, genetics, and feline care from experienced breeders. You push yourself to present your cat at their absolute best. And when a judge examines your cat, praises their qualities, and awards them a ribbon, it feels amazing. But never lose sight of your cat's well-being. If showing stresses them excessively, stop. No ribbon is worth compromising your cat's mental or physical health. Some cats thrive at shows. Others tolerate them. Some hate them. Respect your individual cat's needs. Most people will never show cats, and that's perfectly fine. Your cat is wonderful whether or not strangers with clipboards agree. But if you're intrigued by the world of cat shows, now you understand how it works, what's involved, and what those beautiful cats in photos are competing for. The cat fancy, as the show world is called, has preserved breeds, advanced understanding of feline genetics, and brought together people who love cats. Even if you never enter a show, the work done by dedicated breeders and exhibitors has contributed to the healthy, well-bred cats available today. And for that, whether you show or not, we all benefit. Section 14, the future of cat care. We've covered an enormous amount of ground in this advanced masterclass, from managing chronic diseases like diabetes and hyperthyroidism to caring for disabled cats, handling end-of-life decisions, and navigating international moves. You now have knowledge that goes far beyond what most cat owners ever learn. But let's end by looking forward. Where is cat care heading? What advances are on the horizon? What will feline medicine, nutrition, and our relationship with cats look like 10, 20, or 50 years from now? The future of cat care is genuinely exciting. We're living through a period of rapid advancement in veterinary medicine, technology, and scientific understanding of cats. Things that seemed impossible 20 years ago are routine now. Things that seem impossible today will be routine 20 years from now. And you, as a cat owner, will benefit from these advances. Your cats will live longer, healthier, more comfortable lives because of what's coming. We're going to explore the future across several domains, advances in veterinary medicine and what diseases might become treatable or curable, technology integration and how smart devices will transform cat care, nutrition innovations that will optimize feline health, behavior science, and our evolving understanding of the feline mind, breeding ethics and genetic improvements, the changing human-cat relationship and what cats mean in modern society, research gaps, and what we still need to learn, and your role in shaping this future. Let's start with veterinary medicine, because this is where some of the most dramatic changes are occurring. Feline medicine has traditionally lagged behind human and even canine medicine. Cats were understudied, their physiology poorly understood, and treatments were often adapted from dogs rather than designed for cats specifically. That's changing. Cancer treatment in cats is advancing rapidly. Targeted therapies that attack cancer cells while sparing healthy tissue are in development. Immunotherapy, which harnesses the cat's own immune system to fight cancer, shows promise. Monoclonal antibodies designed specifically for feline cancers are in clinical trials. These treatments offer hope for cancers that are currently death sentences. Lymphoma, the most common feline cancer, might become a chronic manageable condition rather than a terminal diagnosis. New chemotherapy protocols with fewer side effects and better outcomes are being tested. Combinations of traditional chemo with immunotherapy show higher remission rates. Stem cell therapy is moving from experimental to practical. Stem cells can regenerate damaged tissues, potentially treating conditions like chronic kidney disease by regenerating nephrons or joint disease by regenerating cartilage. Early studies in cats show promise. Within 10 to 20 years, stem cell therapy might be standard for conditions currently considered irreversible. Gene therapy, correcting genetic defects at the DNA level, is in its infancy for cats but advancing in other species. Hypertrophic cardiomyopathy in Maine Coons and ragdolls is caused by specific genetic mutations. Gene therapy could potentially correct these mutations, preventing the disease entirely. This is years away, but it's coming. Chronic kidney disease, which affects so many senior cats, is a major research focus. Current treatment only slows progression. Future treatments might halt it entirely or even reverse damage. Medications targeting specific pathways involved in kidney fibrosis are being developed. Artificial kidney support, similar to dialysis but more practical for cats, could extend life significantly. Diabetes management is improving with longer-acting insulin formulations, requiring less frequent dosing, continuous glucose monitors designed for cats that eliminate fingerstick testing, and islet cell transplantation, which could cure diabetes by replacing the insulin-producing cells destroyed by the disease. Pain management is advancing with new medications that provide better pain control with fewer side effects. Cats metabolize drugs differently than dogs or humans, so cat-specific formulations are critical. Non-pharmaceutical pain management through laser therapy, acupuncture, and physical rehabilitation is becoming more mainstream. Infectious disease prevention is improving. Better vaccines with fewer side effects and longer duration of immunity are in development. The dream of a truly effective FIP treatment is becoming reality. GS441524, an antiviral, has shown remarkable success, treating FIP, previously considered universally fatal. It's not yet legally available everywhere, but it represents a massive breakthrough. FIP will likely be a treatable disease within the next decade. Technology integration into cat care is accelerating. Smart litter boxes that monitor weight, litter box usage frequency, urine volume, and waste characteristics are already available. Future versions will analyze urine and feces for early disease markers, alerting you to kidney disease. Diabetes, or UT, is before symptoms appear. Imagine your litter box sending your vet alerts about concerning changes. Wearable health monitors for cats, similar to Fitbits for humans, are in development. These track activity levels, sleep patterns, heart rate, respiratory rate, and body temperature. Deviations from baseline alert you to illness before it's obvious. A cat becoming less active or sleeping more than usual gets flagged early. Telemedicine for cats is expanding. Video consultations with vets for non-emergency issues save trips to the clinic. Remote monitoring allows vets to track post-surgery recovery or chronic disease management from home. Prescription renewals, behavioral consultations, and follow-ups increasingly happen via video. AI-assisted diagnostics use machine learning to analyze X-rays, ultrasounds, and blood work, identifying patterns human eyes might miss. AI can detect early kidney disease, heart abnormalities, or cancers from images with accuracy matching or exceeding specialist radiologists. Smart feeders already dispense precise portions on schedule. Future versions will adjust portions based on the cat's activity level and weight trends, ensuring optimal body condition automatically. For diabetic cats, feeders will coordinate with glucose monitors to adjust food timing. Environmental enrichment technology includes interactive toys controlled by apps, allowing you to play with your cat remotely, automated laser toys and treat dispensers that prevent boredom when you're away, and window-mounted bird feeders with cameras that let indoor cats watch birds while you monitor their enrichment remotely. Nutrition science is advancing our understanding of optimal feline diets. Personalized nutrition, where diet is tailored to individual cats based on genetics, health conditions, activity level, and even microbiome composition, is coming. Your cat might have a DNA test that reveals predispositions, allowing customized food formulations. Alternative proteins address sustainability concerns. Traditional meat production has significant environmental impact. Lab-grown meat produced from cell cultures without raising and slaughtering animals could provide sustainable protein. Insect-based proteins, highly sustainable and nutritious, might become common in cat food. Microbiome research is revealing how gut bacteria influence overall health. Probiotics and prebiotics designed specifically for cats will become more sophisticated, targeting specific conditions. Dysbiosis, imbalanced gut bacteria, might be corrected through fecal transplants or engineered probiotics. Nutrigenomics studies how nutrients affect gene expression. We'll understand which nutrients turn on or off genes related to disease risk, allowing dietary interventions that prevent illness before it starts. Behavior science is deepening our understanding of the feline mind. We're learning that cats are more social, more trainable, and more emotionally complex than previously believed. Research into cat-human communication reveals subtle signals we've been missing. Apps that analyze meows to determine meaning are being developed. While the idea of a cat translator sounds silly, machine learning analyzing thousands of vocalizations might actually identify patterns humans can't perceive. Cognitive enrichment research is showing that mental stimulation is as important as physical exercise. Puzzle feeders, training sessions, and environmental complexity prevent cognitive decline in senior cats, similar to how mental activity helps aging humans. Stress reduction through environmental design is being studied scientifically. Architects and designers are creating cat-friendly spaces in homes, veterinary clinics, and shelters that reduce stress and improve welfare. Vertical space, hiding spots, and enrichment built into architecture rather than added as afterthoughts. Breeding ethics and genetics are controversial but advancing. Genetic testing for breed-specific diseases allows breeders to avoid breeding carriers, reducing disease prevalence. Breeds plagued by genetic issues like Persian brachycephaly, causing breathing difficulties, or Scottish fold cartilage problems, causing arthritis, face ethical scrutiny. Some registries are changing breed standards to favor health over extreme features. Outcross breeding programs introduce genetic diversity into breeds that have become too inbred, improving overall health. This is happening in breeds with small gene pools. Designer breeds created through careful breeding programs might emerge, combining the best traits of multiple breeds while minimizing health issues. However, this requires responsible breeding, not the backyard breeding that produces cats with unpredictable health and temperament. The human-cat relationship is evolving. Cats are increasingly valued as family members rather than pest control. This shift drives demand for better veterinary care, higher quality products, and greater respect for feline welfare. Indoor-only cats are becoming the norm in many countries, protecting both cats and wildlife. This requires increased focus on indoor enrichment and preventing behavioral problems. Cat cafes, where people socialize with adoptable cats in coffee shop settings, are expanding globally. They reduce shelter overcrowding and introduce people to cats who might not otherwise adopt. Workplace cats, in offices that allow pets, improve employee well-being and morale. As remote work becomes more common, more people experience the benefits of having cats nearby during work hours. Therapy cats in hospitals, nursing homes, and schools provide emotional support. Research documents measurable benefits of animal-assisted therapy for anxiety, depression, and recovery. Research gaps remain. Despite advances, we still need more understanding of chronic kidney disease causes, why it's so common in cats, and how to prevent it. Feline hyperesthesia syndrome, the twitchy cat disease, is poorly understood. Idiopathic cystitis has no known cause. Many behavioral issues lack evidence-based treatment protocols. We need more research on cat cognition, emotions, and social structures. Funding for feline-specific research is limited compared to canine or human research. As cats become more valued, funding increases, driving more discoveries. Sustainability and environmental concerns are increasingly important. The pet food industry has a significant carbon footprint. Finding sustainable protein sources without compromising feline health is critical. Litter production, especially clay litter, has environmental impact. Biodegradable, sustainable alternatives are improving. Disposable products like plastic food bowls and toys contribute to waste. Durable, recyclable alternatives are emerging. Your role in shaping the future matters. As a cat owner, you influence this future through the choices you make. Supporting ethical breeders over kitten mills improves breed health. Adopting from shelters reduces overpopulation. Choosing sustainable products encourages companies to prioritize environmental responsibility. Participating in veterinary research studies advances medical knowledge. Voting and advocating for animal welfare legislation protects cats. Educating others about proper cat care raises standards. Providing excellent care for your own cats sets an example. The collective actions of millions of cat owners shape the industry, drive innovation, and determine what becomes normal in cat care. Your voice matters. Your choices matter. As we look at everything we've covered in this advanced masterclass, from the complex medical knowledge in the first sections to the practical skills and the forward-looking information here, you should feel proud. This isn't casual, surface-level information. This is deep, expert-level knowledge that puts you in the top tier of cat owners globally. You now understand diseases most people have never heard of. You can handle emergencies that would send others into panic. You know how to assess quality of life and make the hardest decisions with confidence. You understand your cat's behavior on a level that transforms your relationship. When you started this journey, maybe you were just a person who loved cats. Now you're someone equipped to provide truly exceptional care. The difference between you and the average cat owner is vast. Your cat, or your future cats, are lucky to have you. The future of cat care is bright. Cats will live longer. Diseases that kill cats today will be curable tomorrow. Technology will catch problems earlier. Nutrition will be optimized. Environments will be enriched. And the bond between humans and cats will deepen as we understand them better. You're part of that future. By learning, by caring, by constantly improving, you're raising the standard. You're showing what's possible when someone commits to being the best cat parent they can be. Thank you for investing this time. Thank you for caring enough about cats to learn at this depth. The cats in your life, past, present, and future, benefit from your dedication. Keep learning, keep asking questions, keep advocating for cats, and most of all, keep loving them with the depth of knowledge and commitment you've demonstrated by completing this masterclass. The future of cat care is in good hands, yours.